It's live. Is it? It is. Little red things flashing and everything. Let's pretend to be doctors on Code Blue. And, well, let's pretend to be doctor. That's not quite right. How about with some ... Code Blue. A game. Maybe even somewhat educational. There we go. 503, service unavailable. Okay, well, I guess to the main Twitter site we go. Unless Twitter itself is down. Your tweet was posted. Woo! I did it. I hope you're all so proud of me. Alright, did that. Close this. Cannot listen to the High Llamas on Twitch or I will get murdered by the Twitch copyright police. MonotoneTim. Yes, that's where I need to go. Gotta pop out the chat. I'm on the new page, which I tried to make look somewhat better. I don't know if it is better, but it's not as bad as it used to be. I still need to fiddle with it, but I'm lazy. So, let me pop the chat out so I can actually read it. Pop out. Okay. Close you. Minimize you. Go into windowed mode. Or not windowed mode, I'm sorry. Windows 7 basic mode. That one. Basic and high contrast. How about... what does this look like? High contrast black. Oh. Oh no. That's pretty bad. Why would I ever want this? Unless I really want to feel like a TV hacker. Well, you tried Windows. I don't think I'm ever going to use those, but hey, it was worth a shot. So anyway, I want to play some Code Blue, which is a game I have now that I'm home. Where's the disc? I have it here somewhere. I think. Nope, it's not that. That's greeting card software. God, I have so many discs, I can't get them out. There's a floppy in the way. 2 floppies. 3 floppies. One of which is labeled Tim's... I think it says hard drive? It looks like it says Tim's hand drive stuff. Huh. Which is apparently fit on 1 floppy. And looks like I wrote it in 4th grade. I should get a floppy disk reader and find out what this junk is one day. Where is my thing for Code Blue? Is it this? No, that's Lego Chess. It's the Oregon Trail. That's Sims, Jumpstart, Monopoly, Lego Chess again? Oh no, that's Lego Racers. Battleship, Stunt Track Driver. I know I had this. No, that's SimCity 4. Hello. I will put the game on in a minute. It's not really too important to find it. I made disk images of it because my disk drive is super loud and running it off the CD will sound like I'm streaming next to a helicopter. So, if I don't find the disk in a minute or two, I will just ignore it. I was kind of hoping it said something on it that I could read, or maybe it would tell me how to play. Kid Pix Deluxe? Nope, not that. There it is, Code Blue, right at the very top, where I can't see it. I can't get the disc out. What's this? Lego Racers 2. Oh yeah, that game. I totally forgot that existed. I remember it didn't run on my old computer, so I never really played it that much. Oh, there it is, Code Blue. Code Blue, the all-new interactive ER game, which will only run in Windows 98, so let's open that up. Give this a moment to warm up. Code Blue, Legacy Interactive. It's got a bunch of words written on the cover, including abdominal, lumbar puncture, ultrasound, palpitation, 120 over somebody's face is in the way. Hemophilia. Something that says with another face in the way. Maybe that means femur. I don't know. Let's see. Minimum system requirements. Hope I have these. What do we need? Windows 95 or 98, 233 megahertz Pentium. Pentium anything, I guess. That's a problem. I don't have a Pentium anymore. Neither does anybody. High color or 16-bit capable 2 megabit video card, or megabyte. 16x CD-ROM drive, sound card, and mouse. I have some of those things. And it also includes a copy of QuickTime. I'm the luckiest man on earth. So let me put the disk in the drive, and by that I mean mount the ISO, because I want to save you having to listen to my CD-ROM drive, which is super loud, but got the disc right here. Totally bought this. Or I got it for Christmas one year, and it freaked me out. Because I'm like 10 years old, and I'm being tasked with saving these people's lives, and I would screw up, and they would spit in my face, and then I'd have nightmares. And I'm 21 now, and it still doesn't really make me want to be a doctor all that much. Visit CodeBlueOnline.com. Play or create new ER cases. Oh, that sounds like a thing I need to do. But first, let me make this all full screen so you don't have to see 2 desktops. That might be a little excessive. Close you. There's Windows 98 again. I feel like any day where I can open up my 98 virtual machine is a good day. And put that there. Have I seen Oregon Trail? I think I have. In fact, I think somebody gifted it to me last night after the stream ended. Am I sure I have a mouse? Yeah, if you have a trackpad, this game will not work. It will just refuse to go. There we go. There's the chat. There's Windows 98. There's a little gap in between. Oh well. Let's see. What did that say? Code Blue Online. Player create new cases. Okay. What I need to do first, I think I already have it installed here, except it didn't work, so I need to uninstall it. Assuming it's still installed. Maybe I already got rid of it. Who made this? Legacy. That's right. Is there an L on this list? Legacy Interactive. Well, I can just go into this, I guess. Code Blue. Uninstall. Now that's install. Well, I guess we'll install it. Maybe it was never there. How am I today? I'm alright. Let's install this guy. Code Blue, I want, I guess, typical? Not really much of a difference. Oh, wait. That's like 250 more megs. Okay, maybe there is. You're now ready to install Code Blue. I sure am. Ooh. 35 seconds. Let's read the instruction manual. Questions? We're here to help. Contact customer support 8 a.m. to midnight. Well, still counts. Eastern Standard Time, Monday through Friday. 410-568-3636. For Windows users, insert Code Blue into CD-ROM drive. Double-click on My Computer. Double-click on Code Blue. Double-click on Install. Follow the instructions. Sounds fair enough. Disclaimer. Although the developers of Code Blue have made every effort to ensure the realism of this simulation, this game is intended for entertainment purposes only. Code Blue may help you become more knowledgeable about the human body, but it is not intended as a guide for self-diagnosis or treatment. Medicine is a complex and inexact science, and somebody logged on to Steam, so I should close that. In other words, if you play this game, you're not going to become a doctor. Diseases, treatments, and responsibilities vary for each individual. If you suspect somebody has a medical problem, call a physician. Don't play through this game and think you know what you're doing. Blah, 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 blah. I'm apparently part of the residency program at Legacy Memorial Hospital. Treat the patient as quickly as you can, because you will get time bonus points. Is that how it works in real life? I hope so. Let's see, there's easy, normal, and expert. Do you think I'm an expert doctor? If you know the significance of BP 200/104 or RR28, then this is the level for you. I know what one of those things is. If you ask for hints at this level, you will lose points. Chat's messed up. Oh, you're right, sorry. There you go. Fixed it. Sorry about that. Install QuickTime 4. I think it's installed, but I guess it never hurts to try again. I'll just have more QuickTimes. Oh dear. This is old. QuickTime 4 enables your computer to handle video, graphics, music, sound, sprites, text, VR panoramas, animation, and content streamed over the internet. Hot damn. English. Swedish. Oh. Well, those look like letters. I'm gonna go back to English, I think. I agree. Sure. Whatever. Full. Yeah, I guess. Yep. And plugin. I think I already have one. Register 2. Dr. Tim. Extreme. DeBoy. Trapopster. That's my new last name. Organization. Where is this from again? Legacy. Hospital. Memorial. Funland. Legacy. Memorial. Hospital. ER. Fun Time. Joyville. To the max. With 3 X's. Registration number. I don't have one. I don't have one, do I? No, I don't. Arrgh. This is a real number. There we go. Oh no! Register 2 and registration number are shown exactly as they are in my registration information. I don't have one. I could have sworn that was printed. Oh, I misspelled real. There, now it's gonna work. Or not. Close. And just delete all that. There we go. Updating the registry. Great. Now I have QuickTime. QuickTime Updater. What's the newest version you have for Windows 98, please? Use an HTTP proxy. No, I'm good. Maybe it only works with QuickTime 4. Winning the game. You'll begin at the hospital as a lowly intern. However, as you gain experience through the successful completion of cases, your superiors will note your improvement. No, they won't. That assumes I'm good. Do I want to view the README? No, I'm good. Do I want to view the sample movie? Yeah, I'd love to. Now I need to restart Windows. But what about the sample movie? Ooh, QuickTime. Multimedia. Alright. Well, I've seen all there is to see on the world of computers. Let's see, anything else the instruction manual has? Steps to success. Determine the diagnosis using patient information, diagnostic tools, and images. Sign the clipboard. Ooh, if you don't sign the clipboard, you lose. Complete the paperwork. Carry out the treatment. If you perform poorly on 4 to 5 cases or kill a patient, the medical review board will evaluate you. Positively, I'm sure. Oh, so if I get evaluated twice, then I'm fired. But if I kill one person, it's okay. That sounds good. You must attain a minimum of 175 treatment points. How many band-aids do I need for that? Oh well, that's Code Blue. The instruction manual. Let's try Code Blue. The game. I streamed this 2 years ago? Thereabouts? So, you might remember it. I vaguely remember playing it. I don't remember any specifics, so for all intents and purposes, it's like a new game. So, Code Blue. I'm not going to load up Elvis, just because we got to concentrate. You know, we got to save some lives. And Elvis talking about the fact, you know, that somebody has a huge hernia or tumor is not really going to help me treat them any better. Code Blue. Does it work? It does, I think. Oh, I have to shrink it. It's making noise and also not doing anything. Ooh, there it is. Femur, blood pressure, lumbar puncture, incision, hypoglycemia, defib, hemophilia, x-ray, respiration. Whoops, I'm covering up the chat. I need to move this. It's not big enough. There we go. Yes? Come on, you're missing some words. Code? Blue. I knew that. By the way, that's not the stream encoding the video really badly. It just looks that pixely on my side. So, don't immediately assume something's wrong with the stream anyway. The game just sort of came like this. Okay, that's right. This is, I think, my superior? Or just some confused guy who wandered into the hospital? Website, www. Let's check that out. Legacy Interactive, where are you today? I bet you're making iPhone games. Atlantis, Pearls of the Deep. Oh, look. Now they're all clay guys. Well, that looks like crap, probably because I'm an Internet Explorer 5. Oh well. Configure. I could turn the voices on. It points to her mouth. Or I could pick a different PDA color. God, I don't know. Which one will help me save people? The blue one? Alright, I think I picked the blue one. Oh, there we go. New game. Sure. Anthony Cardio. Nope. Dr. Mr. Tim. Doctor. Pro Nurse. Oops, it's going off the screen. Pro Nurse. MD. DO. Esquire. Mayor. President. Oh god. How many lines of text can I put on this? Also a doctor. Cashier. Oh geez. Soda jerk. Floating head. Doctor. DDS. OBGYN. PhD. Deluxe edition. Dr. Mr. and Mr. Handsome. Colonel. Put a Kappa. Alright. Colonel Kappa. BYOB. Kesha. Whoops. Yep. Hot Stuff. Hacker. BBQQT. Digital Deluxe. The third. Arcade Edition. Oops. Arcade Edition. Sergeant. Sex Bomb. Dr. Dre. Chief Keef. Frankers. Turbo. Arcane. Wizard. Snoop Dogg. Intern. Mark II. Hashtag YOLO. Big Butt. Virginia. Whoops, I'm off the computer now. Real. City Face. Daytona. Mr. Bones. Army of the South. 420, I guess. Heartline. Twister. Oh, so much for that. Now, can I change the experience level? No, I can't, because it's under all the text. So I guess this means we're playing on normal, because I can't click anything now. Can I copy this? I wonder... Oh, no! No, 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 no! My title! Oh, no! Oh, I've ruined everything. Oops. Can I paste? No, no, copy paste doesn't work. Dr. Mr. Tim, Dr. Pro, Nurse, MDDO, Mayor, President, also a doctor, cashier, soda jerk, floating head, Doctor, DDS, OBGYN, PhD, Deluxe Edition, Mr. Handsome, Colonel, Kappa, BYOB, Kesha, 420, Notepad, City Face. It's not the same. Oh well. Somebody saved it, but it's too late. It's too late for Dr. Ister Tim, Dr. Pro, Nurse, MDDO, Mayor, President, all these things I totally misspelled. What is this? D. Mr. Ha in the Dome, Cake Caller, Cap Boot. What was Boot supposed to be? Is that part of my title? Arcade Edition. Oh well. Enter. Disclaimer. If you play this, you're not a doctor. Also, this man should not play the game. Yes. Is there sound? I don't hear anything. Hello?
Do I know you?
Oh, there we go.
Oh, new recruit, right?
Can you hear that?
Don't move. Neil, the diverticulitis in 2 hasn't gone upstairs yet. We need that room.
Neil, my mouth is desyncing from my text. It's very low. Alright.
McGuigan.
There.
No, not a chance. We're short tonight. Don't go anywhere.
You might want to do something about your interlacing.
He'll show you the ropes. But first, let me give you the most important piece of advice you're going to get around here.
Don't be a
If
doctor.
you really want to succeed at Legacy Memorial, be very, very nice to the nurses.
Still low. Really? I maxed it out in XSplit.
I'm waiting for you. I'm Matt Clark. This is Nurse Julia Henderson.
Hi, I'm Nurse Dr. Tim.
I should get back to work. See you around.
You're pretty.
Oh, full house as usual.
Let's not waste any more time. I'm an attending physician here in the emergency.
Is there an echo?
Each
I hope not.
attending is assigned a resident to supervise, and you're my assignment.
No, I am
Evaluate
capturing it
your work
actually.
throughout your time here and report your progress
XSplit has a
to
little
staff.
thing going up.
Don't worry, I'll keep you informed of
You
my
notice?
conclusions. Now,
I don't know if you can see that.
I know that's what preparing yourself for this
It's not very loud.
I don't think you'll be disappointed matching here. Unfortunately, you've come at a time when
Does that help?
our residency program is battling to keep our accreditation.
Hi.
As a residents of
I'm a doctor.
questionable character coming through
No.
here because of their poor ethical choices in treating patients. This hospital and
Oops.
staff were put on probation by the accreditation council. So if it seems like we're being extra cautious around here, we are.
I can't hear you over my control panel.
Be thoughtful, because your decisions and your choices within the various
I'm looking for volume and I can't see. Oh, there it is.
without which this hospital will surely close. I kind of said no, because I did my entire training here, so.
Wait, hang on. Hang on. Do I need to increase the volume on this? Damn it, QuickTime. Max out everything. Okay, let's try that again. Is that better? Sounds louder to me. It's the same. Really? Let me shrink this so I can keep an eye on the volume. Code blue. Maybe louder. Turn the mic down so you can turn up the sound. Okay. There we go. Now I'm quiet. Now you can turn up your sound and maybe it'll work. Possibly? Let's try this again. New game. Oh no, not this again. Quiet tone, Tim. Sound sucks. Okay, I'll put it back up a little bit. Just putting, sorry, I'm not putting that in. Tim. All that other stuff. The doctor. I will never get this sound to work. Fabrizio, the chainsaw karate surgeon. Okay, yep. If you play this game, you're not a doctor. The end. Let's see if this works any better. Oh wait, did that fix it?
Do I know you? Oh, new recruit, right?
I think it might have.
Don't move. Neil, the diverticulitis in 2 hasn't gone upstairs yet. We need that room.
That might be way too loud now.
Doc Clark has been looking all over for you. Hold on a minute.
Yes, it's really out of sync on my
Wigan.
side.
No, not a chance. We're short tonight.
Damn it, Neil, you're ruining this hospital.
Don't go anywhere. Doc's on his way. He'll show you the ropes. But first, let me give you the most important piece of advice you're going to get around here.
De-interlace your
If
video.
you really want to succeed at Legacy Memorial, be
Yes?
very, very nice to the nurses.
If you really want to succeed, sync your voice to your mouth.
Hey, been waiting for you.
Alright.
I'm Matt Clark. This is Nurse Julia Henderson.
Hi, welcome to Legacy Memorial.
Hi!
I should get back to work.
Want to grab a hospital coffee? No? Oh.
Babysitting, Carolyn. Busy?
Oh, full house as usual.
Let's not waste any more time. I'm an attending physician here in the emergency department. Each attending is assigned a resident to supervise and fulfill my
Someday
assignment.
I'll own this
Evaluating
hospital.
your work throughout your time here and reporting your progress to the chief of staff. And don't worry, I'll keep you informed of my conclusions. Now, I know you spent a lot of time preparing yourself for this stage of your medical training. I don't think you'll be disappointed matching here.
I'm disappointed I can't smoke in here.
At a time when our residency program is battling to keep our accreditation. We've had some residents of questionable character coming through here, and because of their
Yeah, the last time I
poor
played, that was
choices
me.
in treating patients, this hospital and staff were put on probation by the accreditation council. So, if it seems like we're being extra cautious around here, we are.
If it seems like my voice is a second behind my mouth,
Thoughtful, because your
It is.
decisions and your choices within the various shifts could determine whether we still have a residency program. Without
who
which
needs
this
it?
hospital will surely close.
what?
I'm kind of sentimental about the place. I did my entire training here, so
He's got a very
I'd just
shiny
like to
head,
keep that from
if
happening.
you've noticed.
We're depending on you.
Whatever.
Enough pressure for one day? Nah. How about we get started?
Sure. Yeah. Receptionist totally believes in me.
You'll begin each shift here at the nurse's station. This is where we keep pending cases. Sometimes a nurse will fill you in on patients waiting.
finally,
on
it
the scene,
sinks.
but since the cutbacks were severely understaffed, so other times you're going to be on your own. Each patient has a clipboard pertaining to his or her case.
And there's like a dozen of
Carefully
them, and that's
review the
about it.
information. Let's see what we got. Dog bite victim. Great place to start. Once you familiarize yourself with the patient's chart, you're going to want to check the research computer for treatment ideas. Let's take our dog bite patient.
Directly linked to Wikipedia.
And to make life easier for yourself, you can download the information from the desktop onto your handheld computer.
Alright. Got my sick Palm Pilot.
There's
I'm a
two
doctor
trauma
now.
days for critical patients. Our dog bite patient isn't critical, so we're going to see her in treatment room 1.
I got the WebMD app on my Palm. Okay. So this is where you start. I think step 1 is to go into the database and you find what a dog bite is. Dog bit. That's not a thing. And, oh, there it goes. Dog bite. Search. Dog bite to left arm, specifically. If you get bitten on the right arm, you're doomed. Sure. And you want to stick that on your palm. Which, I thought I picked the blue one. Oh well. Did they have lupus? I don't know. Yes, they actually do. I can put lupus on my palm. I don't think it'll help. But it's there. If I really need it. Oh, geez. This is surprisingly detailed for a game that I don't think will ever even give you a lupus case. Do they have dysentery? They probably do. Oh, they don't. Huh. Cholera? Oh, there we go. Well, I should probably go check on my patient because she's in the process of dying. And do I need to pick this up, or is it already in my pocket? Oh well, we'll find out. Here's our first patient.
Finally, real-life doctors, like I had forever to wait or something.
Regina, I'm Dr. Clark. This is one of our new residents. I hear you've been having a tough day. You want to tell me what happened?
Gladly. I go out to my car.
I think she deserved it.
Shark comes at me like I'm dinner. And I had told my neighbors 100 times, do not let that dog off its leash.
Poke,
and they're
poke.
like, well, it's just like this itsy bitsy chihuahua. And I'm like, I don't care if it's a gerbil. I want it exterminated.
To be fair, gerbils do bite pretty hard, speaking from experience.
Like the arm isn't good enough for you or what?
Regina, I'm going to turn this examination over to my colleague.
Okay, well I think it's time to break out the old
Refer back to your
defib.
notes if you have to. Any tools you need are located on your trays. I'll be checking back with you soon.
I'm a pro.
Well, let's say it looks like it's just you and me.
Sure is.
I'm getting a lawyer.
Good thing I had Spanish in high school.
No, I'm gonna get a female.
Okay.
Any day now.
It'll be okay. I'm gonna save you. What does my PDA say? Click button 2 to get hints. I don't want hints. Well, let's take the glove and I guess you don't want to touch that. That would be a bad idea. Who's this guy? Why aren't you helping?
I am so sure. I think I got like that post-traumatic sickness disease.
Heart rate's good. Respiratory rate's okay. Temperature? Normal? How do I... Oh, there we go. I guess I want to look at this? Do I need this to look?
Is it bad or is it bad?
That's...
Little dogs are the worst.
Got like a
am I
wood
right?
chip stuck in there. How the... That's... Yep. What do I... How do I fix you? Do I have more tools? Tools. Diagnostics. Diagnostics 2. What's this do? Blood gas syringe.
That dog like it. Oil or something.
Probably not.
My mamacita never treated me so good.
Amputate? Can I? Spinal catheter, rib spreader. Yeah, we gotta get to, gotta move apart your ribs, gotta get to your heart from that dog bite, you know? I would assume you want to clean it. Probably don't want to stick an IV in you yet. Or maybe you do, I don't know. Aerosolized, irrigation, nasal spray, oral med, sponge, topical med. Do I want to sponge it? Do I want to use med with sponge? Get ye flask. No, it's not time for a CAT scan. It's not time for an X-ray.
Maybe my case ain't serious to you, but it is to me. Get a move on.
Clean it with the scissors. That sounds good to me. Swab culture, ultrasound, urine test. I know he got bitten by a dog and everything, but could you maybe pee into this cup? Sponge left arm. There. That might look
How's
better.
everything going here?
Oh, well, we're having a party. How do you think everything is going?
I'm
One thing
helping.
I didn't mention. keep
I apparently
alert
just put a
for
Band-Aid on it.
Cases. They can show up
Yes.
anytime, even if you're in the middle of treating someone. At that point, you got to decide whether to stabilize and leave your patient for the incoming trauma or keep on treating the first one.
What? Excuse me, no one's leaving until we're finished here?
I'll just take your arm off.
No one's going anywhere.
It's fine. You have another one,
We're
right?
all finished. You pick up your patient's chart, fill out the hospital orders.
I'm gonna take up your
discharge
chart and
orders,
throw it in the
and your
furnace.
diagnosis. When you finish with that, sign the bottom of the chart. I'll be back when you're done.
Okay, well. I think I cleaned it. Maybe. What else do I do? Do I need to give it some stitches? Sounds reasonable, right? Stitches, suture and needle. Bandage, gauze.
Excuse me, Doc. I'm over here. You didn't forget about me already.
I feel like you should have some topical anesthetic before I start doing some stitching, but I don't know where that is. So maybe we're gonna have to go in dry. Endotracheal tube, McGill Forceps, medicine syringe. What's in the medicine syringe? It's just there, like... Cautery? I'm not gonna cauterize the dog bite. Defib? Where... Topical medicine, I guess. Where is that? Topical med. Oral med. Nasal spray. Irrigation. Sure. Perfect. Covered your arm in butter. Fry it up for a couple moments and we will be set. Well, it's stitching time because I don't know where the anesthesia is. We're doing this the Civil War way. Do. Oops, that's not... It's not really covering the problem, is it? That's good to me. Easy with that tool, Doctor. You're supposed to be treating the patient. I thought I was! Okay. I'm done. And then I'm gonna assume... What's this? Gauze. Gauze it. I also covered it in staples somehow.
Listen, I'll excuse you this time, but don't
Compress.
let it happen again.
Bandage. There we go. That looks good to me. Do you want a neck brace? But I think I did it. What else do I do? Where's the lollipop option? Can I touch it?
Oh, I am so gonna take that on to court.
Well, painful to the touch, I would have assumed. Put it in a sprint. I already wrapped it. Huh. I'm gonna call it a day. I'm gonna say you're done. How do I finish you? Press button 3, press button 4 to view game stats. Steal her kidney? If I bring in the defib, she dies. I can't kill that many patients. I'll only kill the ones that deserve it. Okay, I think... Options. Nope, don't quit. Go back. Navigate. Nurses station? How do I... Oh god. She's undergoing treatment for mild depression. I hope I fix that. She has not had a tetanus shot in the past 8 years. Oh. That probably means I should do something. Oh well. Oh no! If I had a really, really long name, it would have printed the entire thing. Oh, what a missed opportunity that was. I can't believe I deleted that. Oh well. Tim, all that other stuff, the doctor. I got 68 out of 300 points. That's not very good, is it?
How you feeling?
I fixed
Next
it.
time I want you to treat me and not some student doctor.
I'm sorry you feel
But-
that way,
Women, am I right? No, I'm kidding.
okay, you're on
This
your own
game
now. Just
creeped me out
remember
so much
everything
when I was
told you.
10
Don't
years
forget
old.
to refer back to your notes. Grab another case off the rack.
I can't.
Oh, and remember,
I don't know
alert for the critical.
Why? I guess my parents really wanted me
Come on,
really wanted me to be a
relax.
doctor,
Some of these
but
folks have been waiting for hours.
I don't think this
Pick
is the
a case
best
and
way
let's
to
get
do
it
it.
going.
she did spit on me. I didn't fix her dog bite well enough. I don't know. He's cooking meth in the back.
The little guy's John Cho.
All
This
right.
morning he had a sudden
I could fix
onset
you.
of vomiting, closely followed by a weakness in his hands and feet.
Give him a Game Boy.
Pain in his stomach.
Episodic abdominal pain over several weeks.
Can't even hear this.
Plus, he's
Turn
been
the
in
sound
a
up.
very bad mood. Grumpy, sleepy.
Pressure's normal at 100 over
I like his
58,
bowl cut.
Respiration's 20. The kid doesn't seem to be that sick, but the neural exam may be a little off. The neighbor told me that Mom here leaves John home alone while she works. The apartment's
All those cartoons making him sick.
paint peeling.
Well, why can't
He
you?
hasn't eaten all day. Doesn't want to.
Let me take a good look at your kid, ma'am. Yep, that's a tongue. My professional medical opinion. He has pale skin, and his inner lining of the eyelids were pale, which is great because I totally
I try my
ascertained that
best
by
to look
looking at his
after
tongue.
John, but it's hard when I work so many hours.
Yep, those are eyes. And hair. Pen light. Mouth throat. Ah. Well, you do have a throat. While complete examination is appreciated, precious
No,
time
I
ticks
don't
by.
think he ate anything strange.
Amputate to the face. Heart rate's normal. Oh god. Respiration is good. Temperature? Normal. Blood pressure? Normal. Great. Well, your kid's fine. I'm gonna give him back to you now.
Very active. It's in everything. Put all sort of things in his mouth.
Tools. Let's see. I don't think you can do a CAT scan. Oh, I can do a CAT scan. Cool. Well, I'm afraid your son has a brain. July 6th.
Please, my son, he seemed much weaker.
Oh, I just really wanted to play with it. Come on. If you had a CAT scan machine at home, you'd play with it too. He's being possessed by the thing from The Grudge. Oh man, I think he's got lead poisoning. Well, ma'am, I'm gonna leave your son away for a moment. I'll be back. Let me just check the good old WebMD database. Lead poisoning. Ate something? Lead poisoning. Yes. What do I do? IV meds, medicine syringe. Okay.
Yes, he threw up this morning.
IV meds, medicine syringe. That sounds like things I can do. IV. Oops. IV? I guess. There? There? Where do I put the IV?
You must consult with someone. Please, hurry.
Beep. Okay.
I want a different doctor.
But I'm helping. Beep.
John,
And...
stay with us.
Oh,
Stay
EDTA.
with
It's a
Mommy.
mobile ion carrier. I use that in the lab. Medicine syringe. I don't know what's in this, but it says medicine, so it's good for your kid, ma'am. I don't know where to poke it, though. Not in the face.
The
Shoulder.
doctors say the shot is necessary,
Beep.
John. Be brave.
You have to make the noise or else it doesn't work.
You're a bad person.
What? Am I? What did I do? He doesn't look so bad. He's loving it. What do I do? What if I give you a free splint? Will that make you happy? Can I rub your belly?
He say his hand feels tired, doctor.
I don't think that's helping. Wrists weak, hands drooping. I rubbed your son's stomach and I guaranteed all of that stuff is true. Pen light, I already did that. Stethoscope. That's a chest.
My son say he feel more sick now than when we got here.
Well, your son's a liar, because I did everything I had to. X-ray the chest? Okay. Why not? I have one.
I'm starting to really worry. How serious is this, doctor?
Well, he's got 2 lungs. What might be a heart? Looks like he ate a bunch of pennies. Oh, wait, those are lead paint chips. I'm gonna have to get your son taken away, ma'am. I'm a doctor. That's my job. Asian American. Okay. Hospital orders. Labor. Ma'am, your son is pregnant. Medical floor. Neurology? Well, if your kid's got lead poisoning, neurology doesn't seem like a bad idea. Pediatric. Not derm, family medicine, general surgery. Internal medicine? That seems okay. Diagnosis. Crack lung syndrome. Back pain, no. It's lead poisoning, but where is that in the list? Lead poisoning. Lead poisoning. There it is. Blink. Puncture wound with lacerations. Oh, that's right. I didn't get any points because I never checked off on that last person's chart. They got a dog bite to the left arm. Oopsies. I made a dumb. Also, yes, gastroenterology. You're totally right on that. Follow up with pediatrics. Gastro, not gynecology. Prescription. None of those, I would think. Nope. Special services. Social worker? Do I call out the mother for being negligent? What is children's services, and is that different? Oh well, whatever. Aftercare. For lead poisoning, if that's even on the list. Dizziness? I think he had. Doesn't have lead poisoning here though, so I'm going to assume that's all I can do. Tim, all that other stuff, the doctor. Proclaims your son, 55 out of 300. Professor, I really need to pass this class. Is there anything I can do to get extra points? Hi, how's your
You
son?
made a mistake calling for them to take my boy.
Oops.
We came to this country for a better life, for freedom.
Oh.
Everything I do is for my son, to make life better for him.
We shouldn't have let him eat paint
Right now,
chips.
I can't afford babysitter because I'm saving up my money to send for my mother to come here to help care for him.
Oops.
I guess all that no longer matters, does it?
Have a good day. I can validate your parking. Oops. Well, a doctor's job is to break up families, if this game's to be believed. Hey, I got another one.
Oh God. Oh God. I can't get a breath. I can't get a breath. Oh God. Oh God.
Need help with that baby, ma'am?
It's pain in my chest.
I can get it taken away.
Look.
I'm good at
It feels
that.
like someone trapped the weight in my chest. Right in the middle.
She on LSD.
Pain. Ow! It moves it starts on the side of my face, right?
Hi.
And it moves down the side of my arm. It goes right down. Oh God. Do you think this can be from all the smoke in the club? I mean, look. I had a couple martinis earlier.
I don't think
okay?
there's anything wrong with you.
Ah!
Actually, no. There's probably a lot of things wrong with you.
I've had a little problem with cocaine. I went away to rest like a year ago. Is my problem.
I like your bacon
And,
shirt.
I mean, I swear, I don't do it anymore.
That looks
okay?
delicious.
Oh, I don't do it anymore. But do you think, like, in some way, this could be like a residual effect from my past habits? Oh! Ah!
I gotta get home. No more fooling around. I need help here. Pronto!
I have no idea what's happening. Maybe she's on drugs. Yes, she's probably on drugs. Oh God.
What's with the 20 questions? I'm clean. I swear.
So I have this cup I need you to pee into. Could you do that for me? Where's the cup? Where's my pee cup? I can't find it. Oh, there it is. Use urine cup on pelvis.
Listen, I said I was clean.
That is
this
pee.
This a waste of time.
Recent cocaine use indicated.
I cannot, repeat, cannot stay overnight.
Why are there 3 people watching me? They're freaking me out, guys. Alright, WebMD for cocaine. This is for a heart attack. This is not for simply cocaine, is it? How about drugs? Overdose? It's not acetaminophen. It's not toxic seizure. Not organophosphate. I guess overdose. CT scan of the head. Cut off her hand. You think it's a dog bite. CT scan. Designer drugs are dangerous because their makeup is unknown. Well.
Yo, Doc! Little attention here!
Hi. Well, that's a melon. What do I do? What do I do if someone's having a cocaine overdose? I hope this doesn't get me
Pains in
banned.
the jaw. And down my arm.
No evidence of heart failure? Well, that's good. I'm already suspecting drugs, actually. Yep, that's... Is she bleeding out of her nose? Or is that like a little piece of something? Skin normal. Well, that's
Yeah,
good.
I did a lot of powder. Large powder. Oh, but that was years ago. I kicked.
She's talking about skiing, right? Give her oxygen. Sounds good. Here you go. Perfect. Does not look like it was photoshopped in at all. Pulse ox increases. Well, I wish I had tested for that. Chest tube. Rib spreader. Cautery. Spinal catheter. I think these are all overkill. Can I wipe your nose for you? What's this? Irrigation, aerosol, nasal spray, oral meds? God, I have no idea. IV on the left elbow. Sounds good to me. Beep. Alright. What's this? IV meds. I don't know what else to do. She's dying. Oh god. What do I do? What do I do? Check vitals again. Oh god. How do I fix you? IV med in the left elbow. No, there's only one elbow. I'm not a fraud, I'm a doctor. Medication, okay. It doesn't specify what medication, though. Eat this. Ugh. What do I... It apparently helped. Sure. Aerosolized medicine? More. There, now it's like you're smoking. You're used to that, right? Patient inhales unnecessary medication. Oh, god damn. I already did the oral med. IV, endotracheal, McGill forceps. Whoops. Nasal spray. Breathe this. Oh god, now I have like little scroll bars. Where'd that come from? Heart rate's down. That's good. Scan her stomach. I don't think that'll help. What's an x-ray gonna find in her belly? Yep, you have ribs. Indicates recent drug use. Well, I'm just gonna hand you over to the cops right now. Defib. Rib spreader. Spinal tap? I could use hints, but then I don't get points. Try to take a look at the patient's monitor. I did! It beeps. Ah! Okay, there's a blockage of something. Do I have aspirin to give her? Just give me more meds. Did that help? I don't think so. Blood test? That's irrigation? Aerosolized medicine? Oh god. No, none of these. Look up treatment for tachycardia. Alright. Go. Chest pain. She's gonna die by the time I get back. It's not even in here. The deep fib, I don't think is going to work. I already did the urine test. They found she does coke. Oh, man. How you do? Oh. I guess I haven't put the IV meds in yet. I don't know what kind of meds they are, but maybe they'll help. Are you better? Valium and morphine administered, just what she needs. Report her to child services. She's somebody's child, I guess. Pump her? I don't think I have a stomach pump option. Mention pulmonary edema on the x-ray. Did it? Pulmonary edema. Wheezing, can't breathe, burned mouth, I feel sick, it hurts to breathe. Near drowning with hypothermia. Is that what you have? Use the rib spreader. I don't think so. Stitch your mouth shut. Are you better yet? Okay, respiratory rate is a little better. Blood pressure's a bit high, but not as bad. I'm gonna call it a day. I'm gonna say you're fixed. And now you just have to ride it out. Manager of rock bands. That doesn't seem sketchy at all. She's going to die, is she? But what? What do you want me to do? It's only beeping a little bit. It's a heart attack. Okay. Heart attack. Search. Vomited blood. Can't breathe. Fainted. Goddamn. WebMD is garbage. Knee injury. Heart failure. Stab wound. Glossary. M. There it is. That one. No, I can't click it. I can't click it. If I have to type it in, she's going to die. I'm not going to know how to spell it. Myocardial in... nope. INFARC. Is that right? There it is. I did that. I think I did that. Glove, pen light, blood test lab. I didn't do that. X-ray, ultrasound. I didn't do that either. Topical medication. Okay. So the only thing I haven't done yet is topical med and... I think a CAT scan? No, I did a CAT scan. So topical med and the blood test. And I don't know where that is. Topical med on your... I don't know where this is going. On your head. There you go. Now you're happy. Skin, right?
I thought seeing a doctor was supposed to improve my health.
It did.
Is there any way the rest of my stay here can be a little less dangerous? Okay?
Did I help? No?
Right.
Hi.
You are... don't remember the name.
I'm
Another
helping.
first year, right? Welcome. I don't know what you've heard about the residency program here at Legacy, but whatever it was, forget it. As far as I'm concerned, we're starting this year with a fresh slate.
Not very
That
good if you took me
means
in.
We expect much more from our residents than we have in the past. My aim is to make this one of the toughest, strictest, and most respected programs in this country.
Okay.
Spit out some damn good doctors in the process.
I can do that.
We're becoming very hands-on with our new residents. I personally will be reviewing all of your work. And I can promise you, I don't miss a thing.
I think she likes me, guys.
Please, Doctor, don't make me regret my decision to bring you on board.
Uh-oh. Well, what do you have to say about my performance?
Before you treat the wound, it's important to cleanse the area. Well done.
Thanks.
You correctly applied topical medication. Looks like your sewing skills came in handy on this case, didn't they, Doctor?
Not my anesthesia
Nice to
skills.
see you didn't forget the basics. You needed to bandage the wound, and you did.
I did?
Before you treat the wound, it's important to cleanse the area. Or have you forgotten that small detail?
Didn't I do that?
No matter how well you perform in examination, diagnosis, or treatment, if you don't finish the job, you ignore your duty. Be
Okay.
sure to remember the discharge orders next time.
You're right about that. I forgot to fill out the paper.
Your diagnosis was incorrect.
I didn't make one.
But let's learn from this and push past it.
Well, look, if I didn't make one, I'm not wrong, am I?
While this patient's case was not critical, I expect a higher standard of care from you.
Okay. I forgot to do all these things. Oops.
The lead poisoning case. Put yourself in the boy's situation, Doctor.
I did.
Do you really think you'd be here if you'd grown up facing this kind of poverty? Doctor, did this patient present signs of heart trouble?
It might have.
Then why the 12-lead EKG?
I don't know, it's
What
there.
is your justification to listening to this patient's chest with a set of presenting symptoms like this? Often the mouth
don't-
offers important insight into any possible infection. I know we don't want to aggravate a patient's condition,
I
but
wanted to
confirming
pet him and
and
let him know
locating
everything's okay.
pain are vital to a proper diagnosis. It's important to run blood tests.
Oh,
In
there
this
was a
case,
blood
the
test option.
chemistry would
Totally
have
missed
offered
it.
valuable clues to identifying the cause. Lead poisoning from peeling paint. Not only is a CT scan an expensive procedure, but it can also be frightening for the patient.
Well, he's
Order
gotta
them
grow up
only when
sometime.
necessary. Sharp eyes, Doctor. This patient's weak state demanded the introduction of intravenous fluids. I found your discharge orders sloppy, Doctor.
I found your face sloppy. Punk. Aftercare instructions, dizziness. Look at the kid's eating paint chips. He's... Ah! The chat kept telling me to do gastroenterology, and I got wrong on that. I got marked down because I listened. Damn you guys! You're never gonna get into this residency program now. So, nausea, vomiting, and diarrhea is correct. Dizziness is not. Bummer. Now the drug addict.
You signed the
Great.
patient into the hospital, but failed to list a comprehensive plan for hospital care. Be more careful next time.
I took the mom away. That's a good start.
You found the cause of this boy's symptoms. Good work.
Thanks.
While this patient's case was not critical, I expect a higher standard of care from you.
Okay, maybe I screwed up a couple things. I don't know what doing or what using the pen light for is incorrect. It seemed alright to me. Oh well.
Jackie Slavin. Difficulty breathing, history of drug use, and in the music industry. Big surprise.
Way to
Glad to see you
stereotype.
checked rhythm. In a case like this, it's crucial. I can't believe the RR on this patient. I found
go for
this
some R&R
patient's
right now.
BP particularly telling. You did too. Good work. What you should learn from this is how effective the 12 lead can be in determining
I don't know what
heart
I'm looking at.
ailments. This patient's temperature was an important indicator you overlooked.
Was
Skin
it?
temp and color are very important to note, don't you think? If you had
Maybe?
run the appropriate blood test, you would have noticed elevated cardiac enzymes pointing to a possible myocardial infarction.
I knew
Not
that,
only
though.
is a CT scan an expensive procedure, but it can also be frightening for the patient.
It's a bowl
Order
of
them
cereal.
Only when necessary.
Oh.
I'm curious how you can ignore an ultrasound in this case, Doctor.
thought I did
Signs
that.
of wheezing, labored breathing, or rapid breaths need attention. You helped the patient by administering oxygen via mask.
I did.
The right decision. Sharp eyes, Doctor. This patient's weak state demanded the introduction of intravenous fluids. Nitroglycerin pills are a staple to treating victims of
I
heart
just
attacks.
gave her the whole
Glad to
bottle.
see you offered this necessary treatment. The treatment indicated was not necessary.
I don't think I did
The
that.
treatment indicated was not necessary. Doctor,
did that.
you forgot to apply topical medication.
No, I didn't.
Your hospital
I put it
orders
on her
list is
face.
incomplete.
Why would I put it on her bra? It's not going to get to her skin that way.
Despite your misdiagnosis, Miss Slavin pulled through her heart problem. Let's hope she can kick her cocaine habit before she has a coronary, and that she'll pick up on vital clues and draw the right conclusions next time.
Heh. Okay, I don't know why it beeped at me. I'm a doctor. Hi.
You just finished your first shift, right? I can always tell.
I killed
You got
3
that
people
look.
today.
Like a raccoon caught in the headlights.
Thanks,
Seen
you
it
too.
100 times. Don't worry, your shifts are only going to get harder.
Heh. Bite me.
Why don't you relax in the break room? Take a nap, have a snack. You'll be sorry if you don't. Next shift will begin before you know it.
Can I have some of those pork rinds? No? Guess not. Well, I'm gonna go to the break room. Hello, fellow doctor. Dirt.
Be very careful of the Java around here. So I was
Why?
just going over the
Oh.
charts for your first shift, particularly John Chu, that lead poisoning case. Excellent work.
Thanks.
Some of our more
I had fun deporting him.
doctors might have been aggressive with Lian Chu, maybe calling in social services about the safety of the boy, but you saw there were no previous reports of neglect and that the mom meant well by her son.
No, I totally called social
What I am
services.
going to do is send a public
Wait,
health worker
were you
over to
there?
visit them. They'll help the mom clean up the place, make it safe for her kid to live.
Why is the audio out of sync? I have no
Get
idea.
some sleep before your next shift. You'll need it. Oh, and make a fresh pot of coffee, would you?
What am I, the inter... Oh, wait. Coffee. Huh. It's like I'm really drinking. It's just a static picture, though. Diseases of the digestive system. I can't read that. Nope, that's a thing. Can I pull the fire alarm? Read the funny papers? Sit down? Prank call someone? Nope. Can't do any of those. Well, let's go check out the trauma room. The other trauma room, which is the same as the first trauma room. The treatment room. The nurse's station.
It was
Hello.
nice and quiet around here till about 5 minutes ago. Hope you brought an extra pair of scrubs.
Oh man. Waited my whole life for this.
Work around children, I always seem to get these darn flu bugs. Younger teachers never miss a day. Seem to have better resistance. And I've used up all my sick pay.
I'm not really a smoker, by the way.
Now, please, not now.
Amputate the glasses.
Truthfully, I don't ever remember feeling this bad.
Kids, open your textbooks to page 2.
It's the germs that get you, especially around the kids. I wash my hands, must be 30, 40 times a day. I'm nervous,
Oops.
so it's understandable if my heart's beating
Oops.
fast. Machines are so impersonal.
Oh. So, lung infection, anyone? Chest x-ray seems like a way to go.
They're gonna make me retire in 3 years. Well, they're gonna have to pull me out kicking and screaming.
I'm gonna have to pull this IV out kicking and screaming. Bloop. Alright. IV meds, sure. That's not where I put the other IV, but let's go with it.
I think my cough is getting worse.
The tube is going through your face every time you talk.
Sure, I smoke. Pack a day.
There's a tube
but
in your
never
neck.
around the kids.
I think that might be part of your problem. Medicine syringe. Fine, yeah. Why not? I don't know what medicine's in here, but hopefully magic. Bloop.
It's getting harder and harder to breathe.
Oh. Oh! You need oxygen,
My daycare
don't
children
you?
are my family. And when people ask if I have any kids,
Here
I
you
say,
go. I meant to do that. Yeah, she literally smokes in the kids' faces. Cautery? No. Chest tube? No. Defib? Tempting? No. X-ray? Juke. White area superimposed on normally dark regions indicate fluid. How about some oral antibiotics? Yes, just put them in the mask. Tylenol administered, temperature decreases, heart rate decreases. Topical meds. Those gonna help? I don't know. I don't think that's what her body looks like, but... oh well, whatever. I think that's someone else's chest. Nasal spray. That's a really huge container. Nasal spray was not needed. I didn't even diagnose her. I'll get to it. Aerosol. I did. Test your blood. I guess, sure. Oh, it was here. Boop. Got your blood. Elevated white blood cell count. Well, alright. Probably some lung infection. Swab culture. Let's do one of those. Do I have a result? Positive for bacteria. Taunt her with the blood. Now I'm going to clone her. Well, I administered antibiotics. I did a bunch of tests to prove she's got some sort of infection. I don't think a stool sample's gonna help. How is your skin? It's moist and warm to the touch. That it is. Can I look at your face? That's a face. Skin is red. Oh, if you say so. Flashlight? Okay. Precious time ticks by. Well, I think I've fixed her. I'm going to say I fixed her. Hospital orders. Labor? No. Orthopedic, medical. I guess medical? I already did a chest x-ray. I gotta diagnose her now. Emergency urgent consultation. Infectious disease? Maybe? None of these, none of these, none of these. Okay. Intensive care general. Respiratory. Did I miss the pulmonary option? Oh wow, I totally did. You're right. Apparently you need to know how to read to be a doctor. Transports. Yeah, monitored with RN sounds about right. If she's still working, she could probably do okay. I needed to spread her ribs. Oh, you're right. Bronchitis? Doesn't seem out of the question. I don't think she has TB. She have cough? I'm gonna say bronchitis. Or pneumonia. Bronchitis it is. Back pain. Nope. Abdominal pain? Nope. Drowning? Yes. It's not bronchitis, it's pneumonia. She's an abuser. It could be polio. I'll just pick both. It's one of these. I'll just hedge my bets. Simple electrocution. As opposed to what? Did I use a stethoscope on her chest? I think I did. Oh, I thought that said bums. It says burns. No, she doesn't have polio. Crush injury, vomiting blood. No, not this time. Motor vehicle accident. Gunshot wound. Schools got dangerous. Discharge. Pulmonology. Prescriptions. Antibiotic. Aftercare. For breathy things. Where are they? Chest pain. No. Not chest pain. I don't know how to doctor the game. I'm sort of learning. Pneumonia. Upper respiratory infection. One of those. I'm gonna sign off. My professional opinion, I've saved this woman. 86 out of 300. That's pretty good. It's the best score I've gotten all night.
I came here because I couldn't afford a private hospital.
I
But
helped.
I still expect the same level of competency.
I thought I did. What?
I've got your name, Doctor.
Oh. Well, at least you're walking.
I'll be mentioning this to your superiors.
Oh, they already know. Who else can I break? Oh, this guy. I'm dying.
Must be new. I'm Monty Rodriguez. It's my back, Doctor.
I've got a terrible
Worst
condition of
pain I've
cut-off
ever had.
shorts.
See, I've just been elevated to senior fry cook, and what with my new responsibilities and the accompanying stress, I've been a little preoccupied, so I wasn't looking when an obese garden gnome of a man in a brown hat took an umbrella and prodded me in the back with it.
I wasn't looking. My voice got desynced from my face.
I might add. No, I am certain that I am going to need countless x-rays,
I don't know who this is, but everyone else seems to.
maybe even surgery.
Oh, yeah. Surgery. Man,
Before you start,
I think we need to defib this man.
This is my favorite hospital. Everyone is so friendly here.
We are quite friendly. So very friendly. Oops.
Dr. Clark has informed us you lost a patient today.
Well, he deserved it.
The nurses reported you weren't at all competent in that room.
He was wasting
Frankly,
hospital
I want you
funds.
alone here at this hospital. But Dr. Clark feels that you should be given another chance. I can't say this board agrees. But given our trust in his opinion, we'll take his advice.
Thanks.
Let's hope you live up to his belief. As you know, we have been battling to retain our accreditation. The council will have to receive this report.
Will they?
Let's just hope for your sake it doesn't
Let's just
ruin
defib the
everything
council.
for us. Now go away.
Do you need a defib? Okay. Well, that's... It was his favorite hospital. Well, that's why I let him die there. Maybe I'll bring him back. There we go.
This is my favorite hospital.
I'm not gonna kill you this
Everyone
time.
is so friendly here.
Okay. How is your face? I like your glasses. No bone tenderness, no pain.
People don't
Oops. Are you talking? Okay, gave him some ibuprofen and Tylenol. And I think that's probably it. I'm gonna call it a day. I think he's fine. Yeah, he's fine.
nerve of that guy. Poke him in.
Get out of here. He has a broken back. No, I checked. Spinal tap, rib spreader. I gotta try to get some points, you know? Let's send him to labor. I don't know. Can I just discharge him? No. None of these. Holding orders? Nope. Transport? Wheelchair? Probably not. Diagnosis? Nothing. Back pain. I guess. Was he drowning? I don't think so. Discharge. Nothing. Prescriptions. Analgesic. That's about it. Special services. Let's call the police. You're faking it. We're gonna lock you up forever. Can you be diagnosed with being a bad actor? Aftercare. Back pain. That's about it. I'm gonna call it a day. Did I win? 84 out of 300. Oh. I didn't even think there was all that much stuff I could have screwed up.
You're a rookie.
Am I?
It's fine. I know how it is. I started at the bottom myself. But I got where I am today by forwarding customers with fast, friendly, and courteous service from the minute they walk up to the counter.
Yeah, I gave you drugs really fast. Hey, you gonna eat all that? Nice matching bag.
Tell you what. I'll keep your subpar performance between us.
Does this man have caterpillars for eyebrows?
Cocktails to go.
Excuse me, Mrs. Robinson, but I believe you're trying to seduce me. Yeah, it's me in real life. You've found it. Oh, someone who's actually sick.
Jackson Jones riding his motorcycle on 10 freeway where he hit some slick road multiple times. He's complaining of sharp chest pains. Like for him, he had his helmet on. Hey, dude, I'm hurt here. 20 respirators to 28. So
Oh, it's the guy from Left 4 Dead.
I tell you, if they ever took these machines off the road, the experiment has to be out of a job.
Don't listen to the critics, Doc. Bikes aren't as dangerous as they say.
Rock on! Rock on!
There's characters.
No, not Coach, the other one. Francis. Oxygen? Oxygen? Oxygen. Got a bit of a cut there. Patient feels better. Alright, we're done. Pills here. That's not a bad start. Oh, it was. Now I'm causing complications. Damn me and my pills. Topical medication. Not your nose, on your face. The other nose. Topical medication applied. Wait, no, it wasn't. Head. There. Only when... Wait, really? How are there complications from that? I thought I had to diagnose him before you give him drugs, but that hasn't... That's not how the game seems to work. The game just kind of tells me to go and do things. IV sounds like a good plan. Here you go. Bloop. I had to apply it on the eyes? Did I? This music is rockin'. It's going to be healed by the power of rock and roll. Get the glove? I don't know what that's gonna do. Do I make him smell it? Oh god. Someone, really did a number on you with Photoshop, my man. Shouldn't be eating all those staples. Okay. So he's got a collapsed lung. What do you do about that? Can I just blow it back up? Chest tube? What does this do? Stab his lung. Maybe. Chest tube sounds about right. Chest tube in the chest. Yes, that would make sense. Oh god. Gel? Suction tip? Scalpel? What? What? I didn't expect to have anywhere near this amount of choice. Here's some gel. Yep. I don't know what I'm doing. I fixed you. You can stop that now. Okay. What am I doing? I just stuck it in. How? How do I do anything? No, I'm done. Get me out of there. How do I fix him? Air removed from chest. Oh, I did the right thing. Apparently that was correct. Okay. I'm gonna x-ray your face. Oh, I can't x-ray your head. I wanted to see if you had a skull fracture, but probably not. CT scan? Nope. That looks like things. It's expensive. Oopsies. Well, I don't know what else to do. Cautery, chest tube, defib, mask, rib spreader. I don't think it's time for a spinal tap. Is he on drugs? I don't think so. Pen light, stethoscope, tongue presser, magnifying glass, blood gas, blood test, swab culture, ultrasound, cervical collar. There. It's a nice color for you. Give him a few more CTs, turn him into a Marvel superhero. Can I make him pee in the cup? Maybe not. Let's see. Endotracheal. Nope. IV. I did. NG tube. Couldn't hurt. Gel. NG tube. Charcoal. Oh, no. NG tube is if he is poisoned. We don't need that. And no, I didn't insert the tube at all. Why? I said no. I meant... Look, man, I'm sorry. I didn't mean to do that. His right arm is not broken. His left arm doesn't look broken either. I fixed him? Looks good to me. I'm so bad at this. The only thing broken here is his trust in my medical skills. Operating. Surgical? Perhaps? Let's see. General surgery? Perhaps? Maybe? Pulmonology, he's got to collapse the lung, because I know I poked it a bunch of times, partially why it is collapsed. Intensive care? That sounds okay. Transport on a gurney. Diagnosis? I think that's deflated the lung. Throw him in a wheelchair. You don't think he needs surgery? I don't know. I don't even know what cracked lung syndrome is. it's not a kidney stone this time. Abdominal pain. That's because you broke your ribs. Drowning. Nope. Multiple fractures. Internal hemorrhage. Oh, that's what burns. Nope, that's not that. Swollen joints. Nope. Puncture wound. Nope. Motor vehicle. It's one of those. Oh, God. Blunt trauma, rib fractures. Laceration on your face. Doo-ba-doo-doo. Chest confusion. What is that? Can I ever get to 100 points? I don't think so. I don't think I've got it in me. Rib fracture. Rib fracture. Nope, your arms are fine. Doesn't have epilepsy. Just has a bad case of MIDI rock loop. Multiple blunt trauma, gunshot, nope. Wrist injury, nope. Sore throat, nope. Toothache, nope. Unknown toxic, you rocked too hard. Ingested too much rock and roll. Follow up with... pulmonology... surgery? Maybe? Prescriptions. Analgesic, maybe? Couldn't hurt. I'm never gonna get my medical degree from a game like this. Suggest an autopsy for treatment. Doctor confusion. I don't know. Alcohol abuse. That might be assuming too much. Children's services, because he's a kid at heart. Aftercare. Fracture general. Splint? No. Wound? Nah. Yeah, wound care. Sounds about right. If he broke his face, probably needs some of that. There. How'd I do? Badly, I'm sure. 25. That's the worst one yet.
There. That's the loser.
Hi.
The doctor is not the problem. You're the problem, John. I'm telling you, this doc's incompetent. He could have killed me. No,
I didn't.
Your idiot cycle almost did that.
Could have killed you, but I didn't.
I hope you finally learned your lesson. I'm going to sell what's left of that death machine and put the money away for a nice...
Blame the motorcycle, not me.
Just the two of us. Provence? Where's that? We'll talk about this later.
Can I have your bike?
Sometimes what I have to say is unpleasant. Brace yourself. because
Usually.
This is one of those times.
Usually it is. What did I get? 25. I should have given him a haircut. I wish. Shift notes. It's gotta be good.
I have Ms. Riley's chart. Let's go over her flu bug complaint. I'm glad to see you checked rhythm. In a
I
case
sure
like this,
did.
it's crucial. I found this patient's BP particularly telling. You did too. Good work, Doctor.
I guess.
We all wear a stethoscope around our neck for a reason. It's damn useful, especially in a case like this one. Doctor.
Oh, God.
We all wear a stethoscope around our neck for a reason. It's damn useful, especially in a case like this one.
I'm sorry?
Often the mouth offers important insight into any possible infection. In a cardiac case like this, remember that the 12 lead can pinpoint or rule out critical abnormalities.
Oops.
With redness in the throat, it was important to run a swab culture to rule out a possible infection.
I did that.
If you had run a blood gas test, it would have highlighted this patient's breathing problems.
I didn't do
Sharp
that.
eyes, Doctor. This patient's weak state demanded the introduction of intravenous fluids. Good. You injected antibiotics to help the patient's immune system battle the infection.
Yes.
Signs of wheezing, labored breathing, or rapid breaths need attention.
Her
You
face
helped
looks
the
like it's made
patient
of
by
dough.
administering oxygen via mask. The right decision. The treatments indicated were not necessary.
What, needle?
The treatments indicated were not necessary.
A tree-
The treatment indicated was not necessary.
What am I doing?
You completed a majority of the required hospital orders for this patient.
Oh, I didn't screw up so badly then. I don't even know what I did. What treatment was that? Do not apply topical medication to bra.
You kept your head, went down the checklist, and reached the right conclusion. Pneumonia.
I also checked bronchitis, but I guess they knew that was wrong.
While this patient's case was not critical, I expect a higher standard of care from you.
That's so much medication. Why did I give her a dozen aerosolized medications? Oh.
Monty.
Oops.
So, you met our frequent flyer, huh? It's a rite of passage for most of us. Skin temp and color are very important to note, don't you think?
No.
X-rays are costly, Doctor, and in this case, not required.
'Kay.
You recorded what was
Wanted to make me
necessary
feel
to
special.
ensure proper continued care.
Okay.
Communication is key, Doctor. You can't expect the hospital staff to read your mind. Record the patient's hospital orders for admittance and recommended treatment.
I did. I gave him the wheelchair, didn't
A lot of people come to the
Oh,
ER
alright.
presenting nondescript back pain. I'm glad you caught Monty at his old game, but still extended him the quality of care he deserves.
That's why I got like 300 points.
While this patient's case was not critical, I expect a higher standard of care from you.
Okay. Now I know for next time, do not glove his head.
I'm glad to see you checked rhythm. In a case like
Who's
this,
this?
it's crucial. I can't believe the RR on this patient. I found this patient's BP particularly telling.
Did
You did too.
Did you?
Good work. This patient complained of breathing problems. How could you have overlooked the lungs?
I poked it.
Doctor, we all wear a stethoscope around our neck for a reason. It's damn useful, especially in a case like this one. I know we
Oh,
don't
God.
want to aggravate a patient's condition, but confirming and locating pain are vital to a proper diagnosis.
Man, that crash really
X-rays are
blurred,
costly, Doctor,
blurred
and
his
in this
arm
case,
up.
not required. Signs of wheezing, labored breathing, or rapid breaths need attention.
Is that a face
We help
tattoo or a
the patient
scratch?
By administering oxygen via mask. The right decision. Sharp eyes, Doctor. This patient's weak state demanded the
Thanks.
introduction of intravenous fluids.
I'm a pro.
Not an easy treatment to administer, but a necessary one in this case. You scored high marks by choosing the test tube protocol.
Yeah,
The treatments
25.
indicated were not necessary. The treatments indicated were not necessary. Before you treat the wound, it's important to cleanse the area. Or have you forgotten that
I
small
did.
detail?
I used the
You
gel.
apparently ignored this patient's condition. You needed to alleviate the pain, and an injection by med syringe was in line.
But I had the
How do you
IV
expect
med.
the patient to continue treatment if you don't complete the discharge orders?
What? What didn't I do?
There are too many items missing from this sheet of hospital orders, Doctor.
I'm the intern. God, I make you people coffee.
Try not to be so hasty with your diagnosis next time, Doctor. You'll find your success rate will improve.
Okay. Apparently his laceration or rib fractures were not the correct diagnosis. Apparently, they just want me to talk about the fact his lung collapsed and not the fact he broke any bones.
Your ineffective use of the tools and time you had at
I
your
did a bunch of
disposal
good
nearly
ones.
cost this patient
And a bunch of
life.
bad ones. Oh god. Oops. Well, that could have gone better. I'm gonna get some coffee that I deserve.
Yeah, I see you had a motorcycle injury. Femur. Ouch.
Oh,
Think a bad
I didn't
brake
check
like
his
this will
femur.
stop that patient from riding? Not a chance. We call them donor cycles around here. You'll see a lot of these cases. Not just head injuries and broken bones, but road rash, eye trauma, carpal tunnel, ear injuries. You're 14 times more likely to die riding a motorcycle than you are in a car. Idiots.
Don't preach to me,
Matthew.
doctor.
Security called? You need to move your motorcycle. You're parked in a handicap zone.
You're gonna be handicapped if you keep riding that death machine, doctor.
I'm tired of making excuses for you. Your performance stinks.
Oh.
You're hurting all of us. Now get back to work.
But I thought we were Okay. I'm sorry. I'll just go work. What did I do? This patient rocked too hard.
Hi, how you doing? Bobby Silvers.
The
Maybe you know me as
Bobby Silvers?
Showtime Silvers, huh? KROL, DJ. Anyway, you're
Sorry,
probably asking
I'm not up
yourself,
on my Facebook
what's
celebrities.
up with a guy like me taking a reverse pike and tuck 15 feet off a stage at a Beck concert, huh?
Yeah, totally,
I'm hosting
bro.
the show, dude. I'm introducing the man himself, all right?
Yeah.
I'm up there, I'm doing my intro rap, right?
Yeah.
And I'm doing it so well, by the way, that the band is behind me shooting dagger eyes into my back because the crowd is digging it so much.
How do I treat
and
for
the next
dagger
thing you
eyes?
know, I'm crashing headfirst into the pit. Ow!
The audio desyncs all the
My
time.
leg, you know, up top, it's killing me. Yeah, and this neck pain won't go away.
I can't hear you over the guitar riff.
Easily crank on your FM dial, babe. What you waiting for, Doc? An invitation?
Where is the neck brace? I don't know if he needs it. Where is the neck? Oh, there it is. Here you go. Perfect. Heart rate's good. Every time I click this, it yells at me, but every time I don't click it, I get yelled at. Check him for midlife crisis. I think he said his pelvis hurt. Looks like a pelvis to me. X-ray normal. Well, God. X-ray is back. Check his privilege. Amputate pants. Wait, what was his problem again? I've already forgotten. Glove head. Okay. That always goes so well. No bone tenderness, no pain. Remove hair, take his watch. Neck pain. That sounds like breathing. What am I doing? Everything's normal. Do you want an IV? Would that make you happy? Oh, somebody already took his watch. There you go. I'll give you an IV in the watch spot. IV starts unnecessary pain, bleeding, and infection risks. Oh. Oops. I wish I could see his symptoms again, but oops. I don't know where that is. What's this chart say? Complaining of pain and swelling in his upper left leg and of mild neck pain. Oh, the guitar's gone. Oh, you broke a thing. You don't x-ray his neck, do you? No. Oops. There we go. How do I... Can I apply a cast on his leg? Ultrasound? Splint. Leg. Perfect. He's got a really big toe. Splint applied. How about some topical meds? Glove his leg. I guess I could. I don't know what that's gonna do. Yeah, now I can't even see it. Well, now I've convinced myself it is a fracture after I gloved it. Apply the topical cream. I don't think that'll help. I mean, that's all good. I'm gonna say he's fine. Give him a splint. Do the drug test? I don't know. I think he's fine. Rib spreader. Use scissors. Can I use scissors on his hair? I don't even have scissors. I thought I did. I have forceps, but they're not quite the same. Oh, there they are. Well, these would cut a little bit better. Can I cut your hair? Forceps on the head. Maybe not. CT scan. That's brain. Well, I think I fixed it. Disc jockey. Medical floor, I guess. Doesn't need surgery, doesn't need dermatology. Stop using the CT scan. Wait, CT scan the neck? What? You can't do anything to the neck. You can't you can't even x-ray the neck. It's just head or chest. Intubate the neck? I don't know about that. The back? I think I did that too. I did.
Look, I know I'm the idiot that fell off the stage, but word of advice.
You're also the idiot that works in
From now
radio.
on, I'd stick to minor cuts and bruises, or they might catch on around here. You know as much about medicine as I do.
Are you threatening me? Is your hair threatening me? I don't think I got any points for that. You guys made me go do all these extra procedures. Getting kicked out of my residency just to wait. Have I ever gotten a good response? Not this playthrough, no.
18-year-old Marcus Bryan became the city's latest robbery staff at the line. Put up a fight, laying on the third rail, pulling his assailant down with him. Sustained electrical injuries, LAPD pulled him up. We arrived 5 minutes later. Patient was pulseless and not breathing when we found him. Thanks, we'll take it. All right.
So wait, he's not breathing, so I can use the defib? Heart rate 0. That's low. But his temperature's okay. Oh, he's better now. Oh, no, he isn't. Defib, defib, where is my defib? Oh, wait. Oxygen. Then defib. Wait. Do I need to? Yeah, I do. I don't know what this little number means. Yay! Hey, I fixed them. Great. Oh, someone's dying at the moment. Save. Okay. Can I glove your pants? Is that a gunshot? Blunt trauma. Who's this guy?
Pete Reggie Alvarez. He's the perpetrator of the crime whose outcome you've just seen.
Oh, well,
Reggie
let him
and his
die.
victim took spill onto the third rail. He's bleeding out from his left leg. BP 100 over 50, pulse 40, respiration shallow. Gee, I just love helping the bad guys.
Yeah. Hippocratic oath my butt.
No respect for life.
You have a pepperoni in your head. You're doing okay. Well, maybe not. Glove the leg. I don't think gloving helps. Oh god. Jeez. That's awful. Spread his ribs, he deserves it. I don't think that's how medicine works. Bloop. Doctor, he appears to have lasagna leg. Right in the middle. Amputate the tattoo. Oh wait, I should go check on the person who's really dying. Why are there so many doctors hanging around? They're not doing anything. There's 4 of you. Can't you help? I don't know what I'm doing. There's some lidocaine. What's this? Medicine syringe. Why not? Bloop. Tetanus. Fine. Totally what I meant. You too. Bloop. If those are students, I'm a student as well. So what am I supposed to do that they don't already know? Aerosolized medication, irrigation, nasal spray. I should clean that wound up one day. I guess we need to irrigate that. Oh, God. Oh. Well, maybe we don't need to irrigate that. Where is the scrubby tool? Use forceps on his leg to rip out the bone. Why? When I fill out the papers, don't check police because he's probably innocent. Oh God, he's dying. Why are you dying? What's wrong? Uh-oh. Shallow breathing is not good. Oh, thanks for that. No, no. No. Endotracheal. I don't know where the gel goes. I guess in your mouth, maybe. There you go. Stop. Oh, that's right. He's bleeding. I forgot. There. That's a good point. Is it broken? Yes. Here you go. I didn't clean the wound. I don't know what option it is to clean the wound. Every time I do the topical gel, it doesn't work. I'll put it on now. How about that? I'll put it on top of the cast, on top of the gauze. There. Just put it right between the crack. I'm helping. Oh, the sponge! Is that what that is? Sponge covered in white? Oops, he's dead.
I'm taking this patient away from you before he bleeds out. I'm very disappointed in you. We'll talk about this after your shift.
I'm disappointed in that man's mustache. Oh well. I like this one better anyway. Blunt trauma. Bloop. Oops, wrong part of the leg. Oh wait, that's just leg. Bloop. Wait, if there's significant evidence of blunt trauma, why don't they want me to do an X-ray? I don't know what I'm doing. They're trying to get me fired. They've had it out for me since the beginning. I'm convinced. How do I fix this person? Topical medication? Is that the blunt trauma? I don't know. Oh, it's a burn. That's what it is. Is that burned? That looks okay to me. Sponge it? You would suggest the rib spreader. You would always suggest the rib spreader. I'm out of things to do. I don't think we have burn cream. I mean, I just put it on, but I don't think we need to use more of it. Yep. Those are nipples. Should get multiple x-rays. I did multiple x-rays. It said I screwed up. No evidence of injury. Are you sure? Can I x-ray the back? Oh, back. Multiple x-rays. I did multiple x-rays, and now it's yelling at me. How's your arm? Looks pretty bad. Oops, he's dead.
I heard they took that robbery victim from you. That you didn't do such a good job on him. That makes us medics look really bad.
Sorry.
Do me a favor. Be more careful next time.
You got it, Chief.
Tell me, Doctor, are you fitting in here?
I think so. What do you think? Did I sponge the arm? I was about to.
Doctor, did this patient present signs of heart trouble? Then why the 12-lead EKG?
He was dying.
I know we don't want to aggravate a patient's condition, but confirming and locating pain are vital to a proper diagnosis.
Got it.
X-rays are costly, Doctor, and in this case, not required. Not only is a CT scan an expensive procedure, but it can also be frightening for the patient. Order them only when necessary.
I've done
With
everything
trauma like
wrong.
that presented here, I can't believe you overlooked X-rays. Way to identify the break and use
don't
the
think I
splint
did.
to immobilize it. The treatment indicated was not necessary.
Oops.
The treatments indicated were not necessary.
Well,
You
thought
apparently
he was hungry.
ignored this patient's condition. You needed to alleviate the pain, and an injection by med syringe was in line. Your discharge orders were incomplete.
That's because you took him away. It's the only hospital in America that actually cares about overcost. I don't even get points for these.
This case was difficult, to say the least. Given the circumstances, I can see how you went wrong. But that doesn't change the fact that you failed to draw the correct conclusion.
Sorry.
While this patient's case was not critical, I expect a higher standard of care from you.
He fell off a stage. X-raying his back wasn't a bad idea. Oh, maybe if I did it twice. That's... Okay.
I've been looking forward to reviewing this case with you. Let's see how well you distanced your emotions from your exam and treatment. I can't believe the RR on this
I let them
patient.
both die. What do you think?
I found this patient's BP particularly telling. You did too. Good work. This
That's the
patient's
BP of a
temperature was
criminal.
an important indicator you overlooked.
Was it?
Doctor, we all wear a stethoscope around our neck for a reason.
Is it because it's
damn
useful? It is, isn't it?
Especially in a case like this one. Doctor, we all wear a stethoscope around our neck for a reason.
I gotta get one case
It's
right.
damn useful. Especially in a case like this one. With such evident signs of distress, the 12-lead EKG should have been a top priority. Often the mouth offers important insight into any possible infection. A very nasty break. Use of the portable X-ray would have shown you a collapsed lung. Rather an important detail to note, wouldn't you say?
I was trying to use it.
I'm curious how you can ignore a CT scan in this case, Doctor.
I don't know.
I'm curious how you can ignore an X-ray in this
Because
case.
I'm an idiot. Is that what
Doctor.
you want?
I'm curious how you can ignore an
'Cause-
X-ray in this
no.
case, Doctor. Sharp eyes, Doctor. This patient's weak state
really
demanded
curious, aren't
the
you?
introduction of intravenous fluids. Good. You injected antibiotics to help the patient's immune system battle the infection. The endotracheal tube protocol was required, and you followed through like a veteran.
I
Way
did.
to identify the break and use the splint to immobilize it. The
Forgot to
treatment
cover it.
indicated was not necessary.
What treatment?
The treatments indicated were not necessary. The treatment indicated was not necessary. The treatment indicated was not
Do you just want me to put the
necessary.
cast on
treatment
top of the
indicated was
wound?
not necessary. The treatment indicated was not necessary.
What?
In cases of such dire pulmonary distress,
You just
chest
want that to
tube
go on
protocol
top of
was
the bleeding
required.
wound?
You failed to use the cold compress.
Oh,
The
put the
patient's
cold
pain and
compress on the
swelling
guy's
could have
leg,
been
which is
alleviated
splitting
by it.
open.
Before you treat the wound, it's important to cleanse the area. Or have you forgotten that small detail? Your hospital orders list is incomplete.
Well, blame the guy who took it from me.
Often our intuition can mislead us. You made the wrong diagnosis for this patient, and it cost a life.
Well, he was a criminal.
Your ineffective use of the tools and time you had
He
at
was
your
gonna
disposal
fry
nearly
anyway.
cost this patient's life.
Oops.
Electrical shock case, and a critical one. We'll step through this one carefully.
Okay.
Talk about through the roof. You put the EKG to good use in this instance.
I thought the EKG was 0 because he
we all wear a
died.
stethoscope around our neck for a reason.
It's damn useful.
Especially in a case like this one. With such evident signs of distress, the 12-lead EKG should have been a top priority.
Oops.
We offer the portable X-ray machine to provide emergency item imaging. It's not a toy.
Emergency
and it shouldn't
what?
be abused like this. Signs of wheezing,
Oh, that's a
labored
giant
breathing, or
tongue.
rapid breaths need attention. You helped the patient by administering
what are you
oxygen
saying?
via mask. The right decision. You handled the crash cart to defib the patient like a pro. Sharp eyes, Doctor. This patient's weak state demanded the introduction of intravenous
That's a really
fluids.
blurry tube of
To
IV stuff.
properly address and treat the patient's pain, I see you opted for the med syringe. Good choice.
Thanks.
To properly address and treat the patient's pain, I see you opted for the med syringe. Good choice.
Thanks.
You correctly applied topical medication. You needed to bandage the wound,
What wound?
Doctor. Fractures must be immobilized, Doctor.
With what,
The splint
gauze?
should have been used.
That's not a
Before
splint.
you treat the wound, it's important to cleanse the area. Or have you forgotten that small detail? Doctor, you forgot to apply topical medication.
You're skipping.
You signed the patient into the hospital, but failed to list a comprehensive plan for hospital care. Be more careful next time.
Oh, he didn't die.
Do you think this patient's life is a multiple choice exam?
Actually, kind of. I just check off stuff on a list. Well, I think everything at the hospital's going perfectly well. Gotta go chill in the lounge. Get me some JPEG coffee. Oh. Are you my next patient?
You want a pretzel?
Nah, I'm good.
No?
Trying to quit.
I'm on a personal slowdown. I am so sick of administration coming down here and telling us how to take care of patients. Most of them haven't worked the floor in years.
You tell her, sister.
I've been trying to talk the other nurses into getting unionized. Oh, forget about it. Bunch of scaredy cats.
I'll join.
Sure you don't want one?
Let's have a pretzel union. No. Don't be a bad case. Don't be a bad case. Oh, she looks fine.
Oh, good, the doctor's here. Don't embarrass me, please.
Mom,
She
I'm pregnant.
woke me up
Duh.
screaming. I wasn't screaming. The pain was horrible. You were the one screaming. Will you tell the doctor how you feel? They have plenty of other patients to see. What do you think I've been trying to do? All right,
I
the
feel
pain
pregnant.
started at her belly button, and then it moved much lower, and then she complained of nausea, and then... Oh my God. What if she's pregnant? Oh, Mom! If I find out you had sex with Anthony Scapello... We haven't even hardly had sex. Hardly? How do you hardly have sex?
Oh, I had a little sex.
If you're always showing up wherever we go. Will you deal with her, Doctor?
Do I have permission to use the defib?
My boyfriend and I agreed to wait till we're older before sex. 16? Maybe 17.
I don't know about that.
I'm burning up.
Are you? I got this. Sounds like IV time.
There's nothing in here that'll get me stoned, right?
Yep. Wait, where? I can't
My
put
mom thinks she knows me, but she doesn't.
I can't put the IV in. Weird. We put terrible, terrible hallucinogens in your IV. Oral meds? Yeah, why not? Yum. No, that was a bad choice.
Oh, it's like a knife. Or needles.
Oh, I have both of those. Do you need an oxygen mask? Here you go. Use of oxygen when not needed is wasteful. Well, everyone's gotta breathe. P test. Alright. Here you go. Negative pregnancy test. Huh. So she's not pregnant after all. Well, in that case... That didn't do anything, did it? I don't know. I don't know what a CT scan would do. Can I check your belly? Beep, beep. Pain, tender, pain upon, pressure, tension upon, palpitation. Okay. I'm going to use the stethoscope because it is damn useful, as I've been scolded at. Lungs clear. I'm going to use it again. Tongue depressor. Just slip it through the mask. Throat clear. So every time I use the stethoscope, it tells me I don't need it, but every time I don't, it says I wrecked it. I gave her oral meds because I thought it would take the pain away, but perhaps not. Medicine syringe? Yeah, let's go with that. Boop. Oops, I missed. Medicine administered. Do a CT scan on her abdomen. You got it. I don't know what it's supposed to look like. CT scan taken. It's unnecessary. Ultrasound. That's a good point. I forgot I had that. You're not a baby. Oops.
No, you won't, honey. Don't worry, sweetie, okay? It's going to be fine.
They took her away.
I'll be right here for you. Oh, just 1 second. I'll be right there, sweetheart.
Your daughter's pregnant.
Look, I know that appendicitis isn't all that uncommon in kids, but that's still no reason for you to be so lax in your treatment of my daughter. Honestly.
Oh. Well, that wasn't so bad. She didn't yell at me that much. I couldn't even hear what she said the problem was, but... Appendicitis, oh. Oops. Oh, there's somebody dying, isn't there?
Yucklovich, unrestrained driver in a head-on car versus concrete wall. That's killing me. Doctor's gonna fix you right up. Where's Lisa? Is she okay?
I'm not gonna fix you up,
Complaint
actually.
of neck pain and pain to the left side of the chest and the right arm. 2 cm lat to his left forehead. He doesn't remember the event, but denies losing consciousness. It's in pretty good shape, considering. The vehicle has severe PSI. Will someone tell me how Lisa's doing? The Lisa he's referring to is DOA.
Oh. Is that because I treated her?
We're to be married next month.
That's not terribly good, is it? Oh. No bone tenderness. Well, I wasn't checking for that. It's a giant hole in your face. Let me just sponge your face up. There you go.
I think you're onto something there, Doc.
Thanks. Topical medication. Bloop. I can't believe it's not butter.
Started college.
Where
Lisa's going to join me when she graduates.
suture stuff? I wish I had anesthetic, but nope. I tried. Oh god. Oops. Let's just fix that back. There we go.
Looked pretty grim for a while there, didn't it?
Bandage. Compress. Gauze. Bandage. Bloop. Okay. Yes, I saved the eyebrow. Probably CT scan wouldn't be a bad idea. No evidence of brain injury. Yep, or not neck splint. A neck brace is probably a good plan. Cervical collar. IV probably is also in order in here somewhere. There it is. Boop. Okay. Here's some medicine for the pain, which I'm assuming you have. Now you're not going to feel your thumb. Oh. Oh yeah, it is damn useful. I should use the stethoscope. Oh god. Someone really blurred your chest out. I didn't want your back. No, I want your front. No evidence of lung or heart injury. Well, what do you do when there's a rib fracture? You don't have, like, rib splints, do you? Chest brace, that's not a thing. I think his legs got damaged. I could glove him. Nah, it looks okay. Oh, God. Why are you criticizing me for wasting time? I found an important thing there. Oh wait, how's an X-ray normal? That's not normal! X-ray, do a CT scan? You can't do a CT scan unless it's on his chest or his head. Collapsed lung? No. Oops.
I knew it. I knew she was gone.
I fixed her head.
Deep down, I just knew. I loved her so much. Everyone did. I killed her.
Well, yeah.
I know that. So I don't care that you screwed up my treatment.
Oh, that's not so bad then.
I don't care what happens to me from now on. It should have been me that's dead.
Well, that could have defibbed you.
Should have been me.
Wait, this is the bathroom?
Congratulations. The Accreditation Council has shut down our residency program, and you can include yourself as one of the main causes. Pack your things. Do not pass go. Do not collect your last paycheck. From now on, the only reason I should see you walking these halls would be as a patient.
Oh.
And even then, I wouldn't recommend it. Goodbye, good luck, good riddance.
I lost. We hope you enjoyed playing Code Blue. Not really, no. I feel like crap now. They did give me a lot of chances, but I guess it wasn't good enough. Whoa. Rob Collins, producer. Made with Macromedia. Oh. What if I put it on easy? What if I just use the hints? Okay, normal, but I'm gonna use the hints this time. I'm gonna play like a pro doctor. Pro Dr. Tim for Rizzle this time. PhD, DMD, DO, MLG, Kappa, XD, Dr. Acula, LOL, Snoop, Lion, 420, Peel Box, ASAP, DDS, Esquire, MP3, OBGYN, The Run, Hi Mom, The Reaper, USSR, MPEG, No Scope, YOLO, DDoS, Mr. Bones, Damn Useful, MD 12.6 XD, Pokemon, Swag, Bone Storm. I don't know what Froggin is, but sure. Froggin, Frankers, PhD again, Quad, Reboot, Virginia Real, Batman, Y Tim, The Killer, to earn up to URL 1080p, Jersey Turnpike, Coca-Cola, Reset, Wanker, 666p, Pepper, C format, The Best, KK, KCat, KK, Pepso, Fungineer, Pepsi, Pancake, Damien, delete, System 32, oops, it's off the screen. Oh well. Good enough. Okay. This time I'm ready. I'm gonna do this. I'm gonna follow the directions, save all the lives.
Do I know you? Oh, new recruit, right? Don't move. Neil, the diverticulitis in 2 hasn't gone upstairs yet. We need that room.
I'm gonna do it.
Doc Clark has been looking all over.
I'm gonna save these people.
Hold on a minute. McGuigan. No, not a chance. We're short tonight.
I could skip them, but I feel like it adds
Don't go
character.
anywhere. Doc's on his way to show you the ropes. But
I need a
first,
doctor for my squeaky
let me
chair.
give you the most important piece of advice you're going to get around here.
Don't play Code
If you
Blue.
really want to succeed
It'll
in
make you
Legacy
feel bad.
Memorial, be very, very nice to the nurses.
Can I be a nurse? I want people to be nice to me. Last time sucked.
Been waiting for you. I'm Matt Clark. This is Nurse Julia Henderson.
Hi, welcome to Legacy Memorial. I should get back to work.
Apply as a
See you
janitor.
around.
Look, man, I'm just here to clean the bathrooms, okay? I don't know anything about patients.
Full house as usual.
Let's not waste any more time. I'm an attending physician here in the emergency department.
Hey, me too.
Attending is
I don't think
assigned
you're a
to
physician at
residents
all, because you don't do anything.
You're my assignment.
It's all me.
I'll be evaluating your work throughout your time here and reporting your progress to the Chief of Staff. And don't worry, I'll keep you informed of my conclusions. Now, I know you spent a lot of time preparing yourself for this stage of your medical training.
I did.
And I don't think you'll be disappointed.
Played this fucking hour last time.
Unfortunately, you've come at a time when our residency program is battling to keep our accreditation. We've had some residents of questionable character coming through here, and because of their poor ethical choices in treating patients, this
I don't know if it's an
hospital
ethical
and
choice.
staff
Maybe they just
were
don't
put
know
on
what to do,
probation
because no one
by the
helps them.
Accreditation Council. So, if it seems like we're being extra cautious around here, we are. Just be careful and be thoughtful, because your decisions and your choices within the various shifts could determine whether we still have a residency.
My
program,
chest hair will determine our
without which
residency
this
program.
hospital will surely close.
Why do you keep shoving the camera on my face? Jeez.
I'm kind of sentimental about the place. I did my entire training here, so I just like to keep that from happening. We're depending on you.
Spread this guy's ribs? I don't know.
Enough pressure for one day? Nah. How about we get started?
No pressure. I'll just go for a Oh, wait.
You'll begin each shift here at the nurse's station. This
My
is
name
where
would
we
never
keep
fit on
pending
this
cases.
board.
Sometimes a nurse will fill you in on patients waiting to be seen, but since the cutbacks were severely understaffed, so other times you're going to be on your own.
I think all the cases
Each
are
patient
in
has a
order.
clipboard pertaining to his or her case.
Or at least the first
Carefully
couple. I
review
think
the
it's
information.
always
Let's see what we got.
dog bite, lead poisoning.
Dog bite victim. Great place
I thought
to start.
cocaine was before
Once you familiarize yourself with the patient's chart, you're going to want to check
smoking
the research
lady, but
computer for treatment
whatever.
ideas. Let's take our dog bite patient.
We will find out. I know the first one is
Make life
always
easier
dog
for
bite.
yourself. You can download the information from the desktop onto your handheld computer.
Through this serial port.
There's 2 trauma bays for critical patients. Our dog bite patient isn't critical, so we're going to see her in treatment room 1.
She's a critical jerk. That's what she is. Dog bite. Let's check that. Treatment protocols. Dog bite. 2 left arm, specifically. Treatment. Medicine, oral med, sponge, forceps, irrigation, suture needle, topical med, band-aid. A blink. That's a term no one uses.
Finally, real-life doctors, like I had forever to wait or something.
Dr. Clark, this is one of our new residents.
I didn't go to med school
You've
for
been
this.
having a tough day. You want to tell me what happened?
Gladly. I go out to my car, and this little land shark comes at me like I'm dinner. And I had told my neighbors 100 times, do not
Amputate
let that
mouth.
dog off its leash. And they're like, well, it's just like this itsy-bitsy chihuahua. And I'm like, I don't care if it's a gerbil. I want it exterminated.
Were you bitten anywhere else?
Actually, I bit her.
The arm isn't good enough for you, or what?
Regina, I'm going to turn this examination...
Regina, I'm
over
gonna set the
to
hospital on
I'll
fire.
give
Just give me a moment here.
Refer back to your notes if you have to. Any tools you need are located on your trays. I'll be checking back with you soon.
I won't let you down, Doctor.
Well, let's say it looks like it's just you and me.
They treat that dog
Okay.
like oil or
PDA.
something. My mamacita never treated me so good.
Research.
Any day now.
Dog bite. Do 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 do. Do do do. Blood pressure, EKG, pulse ox, respiratory rate. Okay.
Oh, that's some fancy gizmo. What does that do? So many gadgets. Medicine is so high-tech.
Looks good to me. What else?
dogs are the worst, am I right?
Yeah. I wish I didn't have to scroll. Medicine syringe, oral meds, sponge, forceps. I'm gonna forget the order. Medicine syringe, oral medication, sponge. Let's start there. Medicine syringe.
I'm getting a lawyer.
Hey,
to
stop
sue
moving
their
that.
butts. No, I'm gonna get a female lawyer.
Beep. X-ray, that's a good point. Forgot that last time.
Whoa, just a second there. I'm all for slamming them with a big medical bill, but I gotta pay it myself first.
Well, you know, I'm just trying to help. Well, you don't have to diagnose before you do anything. You have to do all the treatment and then you diagnose, I think.
I am so sure I think I got like that post-traumatic, sickness disease thing.
Bloop. Sponge that up. I don't think it made a difference, but... Sponging is normal. Skin is wasteful. Wait. Sponging of normal skin. Wait, what did I... Do it. Oh. I sponged the hand. I didn't sponge the arm. Of course. How could I forget? Why is scrolling on this so slow? It's clearly a zombie bite. Oral meds. Forceps, irrigation syringe, suture, medication, band-aid. Got it. Here you go. Mmm. Tasty. She's going into cardiac arrest? Not yet, she isn't. I'll save you. Forceps? Why am I just cutting the wound?
Hey, you're pretty good. The bites don't look so scary no more.
No, now you have a bunch of scissor wounds to worry about. Do. Could I spell my name? That's my mark. Gauze? Bandage. Compress. Gauze? Then bandage? How is that gonna help anything? What is that? Bandage. Blink. And then topical meds. Keeps it clean and dry, except when you do this. There.
Oh, you are like the best doctor I have ever had.
Aw, I'm so flattered. Alright, bust out the defib. Oh wait, I can't get my thing. Wait, go back. What's this say? Wait, I was reading that.
How's everything going here?
Oh, well, we're having a party. How do you think?
Where'd the attitude come from? You were totally digging
One
me.
thing I didn't mention, keep alert for critical cases. They can show up anytime, even if you're in the middle of treating someone. At that point, you got to decide whether to stabilize and leave your patient for the incoming trauma or keep on treating the first one.
Gasp.
What? Excuse me, no one's leaving until we're finished here?
No one's going anywhere.
Okay.
I'll just cut the arm
All
off.
finished. You pick up your patient's chart, fill out the hospital orders, discharge orders.
I was
and
doing that.
diagnosis. And when you finish with that, sign the bottom of the chart. I'll be back when you're done.
And seal it with a kiss.
Excuse me, Doc. I'm over here. You didn't forget about me already, did you?
Sorry, just checking Twitter. LOL, treating my patient, what a jerk. Hashtag YOLO, hashtag doctor problems. Special services, home healthcare, general surgery, antibiotic, analgesic, animal bite. Got it. I've already forgotten what I had to do. I don't think any of these. Emergency consult? Probably not. Was home healthcare one of them? Wish I knew how to read. General surgery. Yes, that's right. General surgery. General surgery's lonely heart club band. Where am I going? Nope, 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 nope. Nope, nope. Nope. Nope, nope, nope. Multiple trauma with burns, nope. Dog bite, 2 left arm. Home health care. I think that's under discharge. Prescriptions, analgesic, antibiotic. Follow up with home health care, which is somewhere in here. Or is it? There. Now we get to wait an hour for this to come out. Signing this, Pro Dr. Tim, Faux Rizzle this time, PhD, DMD, DO, MLG, Kappa, XD, Dr. Acula, LOL, Snoop Line, 420, PO Box, ASAP, DDS, ESQ, MP3, OBGYN, The Run, Hi Mom, The Reaper, USSR, MPEG, No something, YOLO, DDoS, Mr. Bones, something else, Useful, MD, 12.6, XD, Poe, Swag, Bone Storm, Frogger, Frankers, PhD, Quad Rebo, Virginia Real, Batman, W, The Iller, Teern, 10, Jersey Turnpike, Coca, Reset Wanker, 666p, C Format, The Best, nope. So much for that. What's my score? I don't know how I did. I honestly can't see. I assume it was okay. But God,
How you feeling?
Next time I want you to treat me and not some student doctor.
I thought I did okay.
Feel that way, but
What? The problem? You just hate me because of my name.
okay, you're on your own now. Just remember everything I told you. Don't forget to refer back to your notes. Grab another case off the rack. I'll see you soon.
What did I do? I thought I was
Remember, keep
okay.
alert for the critical cases.
Now I'm never gonna know what my score is on anything.
Come on. We're packed. Some of these folks have been waiting for hours. Pick a case and let's get going.
Sometimes they just hate you. I guess so.
The little guy's John Cho. This morning he had a sudden onset of vomiting, closely followed by a weakness in his hands.
Oh yeah, this one where I take the person, take the kid away.
Abdominal pain over several weeks.
Plus, he's been in a very bad mood. Grumpy, sleepy.
Pressure's normal at 100/58, respiration's 20. The kid doesn't seem to be that sick, but the neural exam may be a little off.
Watching a flash
The neighbor
animation
told
on my
Mom
phone.
here leaves John home alone
Good
while
old
she
decline
works.
of video gaming.
The apartment's a pigsty, dirty, paint peeling.
I was snooping around this kid's house, and
I catch him sleeping
found
more
it to
than
be a little
before.
bit dirty. Okay. Check the kid. Alright. Those are numbers. Spread the ribs open and then rip the rip the lead paint out with your bare hands.
Yes, he threw up this morning.
Yeah, that sounds about right. Okay, I'm not even gonna check the PDF anymore, or not the PDF, the PDA.
What do you see?
Nipples. Pale skin. Oh. Yes, I saw that too.
No, I don't think he ate anything strange.
Let me rub your belly for good luck.
He say his hand is tired, doctor.
His
Let's
hand is
smile
tired?
on us, John.
How did I find out his wrists were weak?
Very good,
Her
doctor.
wrists were weak by touching his belly. Use a cold pack? I don't think that'll work. How about the stethoscope? Because it's damn useful.
He hasn't eaten all day. Doesn't want to.
Got very clear skin. See all these veins everywhere. Lungs are clear. Well, that's good to know. That's a tongue. Very glossy tongue.
Things are looking up.
Dark lines may be an indication of lead poisoning. Things are looking up. Let me tell you.
I try my best to look after John, but he's hard without so many hours.
Ooh, an X-ray rave. Okay, then you have to X-ray the chest, find the paint chips.
Really worry. How serious is this, doctor?
He ate paint.
His eye looked brighter to me. A good sign.
Oh, I thought his eyes were bright because he had various radioactive things
John
in them.
Very active. It's in everything. Put all sort of things in his mouth.
Use my training. My training tells me it's IV time. I helped. Let's go for the 1-2 punch in the IV. Oops. Close enough. Alright, get the EDTA in there. Metal ion carrier. Medicine syringe. I find it weird you can only poke him in the left shoulder.
The doctors say the shot is necessary, John. Be brave.
Shoop. Are you happy? This kid does not look anything. Where do you get this game? I have no idea. Got it for Christmas years ago as a kid. I think that's all I can do without killing him. Blood work, that's a good point.
This will pinch a little, Johnny.
Boop.
Here, hold Mommy's hand.
You can hold my hand. Elevated lead levels. Lead. Bleh. Blood lead. Lead blood. I like how they put PB and lead in there. If you're a doctor and you don't know what PB is, you may have made a mistake. Ointment to the eye? Whoever got me this game must have hated me a lot. That was my mom. That would be kind of sad if that were the case. I think every time I do these, I end up picking stuff here and it yells at me, so maybe I won't do that this time. Hospital orders, I don't know. Sounds like people are playing ping pong in the back. Occupation is first grade student, yes. I'm not sending him to a gynecologist. He's 6. That doesn't seem quite right. Rehab. Gotta get this kid on lead paint rehab. Gotta kick the paint habit, kid. God, I don't even know what to hit. Man, it's not intensive care. I mean, pediatrics I can understand. He probably doesn't need any of these. How long am I going to stream? I don't know. Diagnosis. Lead poisoning. Lead poisoning. Lead? Did I pass it? You can get lead poisoning from a gunshot wound, right? Blunt trauma. Got hit really hard with paint. Unknown toxic. Lead? No. Lead? PCP? Cocaine? Lead. Did I miss lead poisoning completely? Does he have a stab wound? If he has diarrhea, get an antiemetic. Where's lead poisoning? I bet I missed it. Yeah, I must have passed it. It has to be in here. There it is. Let's see. Discharge. Children's services. Home health care. I'm not going to call the social worker this time because they're going to get mad at me. Aftercare. I think abdominal pain was one of them. Nausea, vomiting, diarrhea. Sounds good to me. Tim, no. What? No children's services? Okay. That mom owes me. Defib services. Can I skip my name? Oh no, I can't. Every time. Every time it's gonna do this. And I'm never gonna know what my score is. Oh god, why did I ever do this? This is the worst thing ever. Oh god. No. No, I can't highlight any of this text. You know what your score is once they yell at you. That's sadly true. Is anybody watching this on new Twitch, by the way? Updated that page today. I don't know if anybody uses it, though. What's my score? Is my score 12.6? That looks... God, I have no idea. Let's see if the mom's mad. No!
Thanks for your help, Doctor. I take better care of things in the apartment. Promise. I never knew that peeling paint was bad for you.
Well,
no one can afford paint on the wall where we come from.
You don't eat it.
Costs, from now on, I make sure to have someone look after John while I'm working.
That kid looks like he's got a coconut for a head.
Trust me, you will see.
I could have had your kid taken away, lady. You owe me. I saved one kid. Oh, it's the cocaine addict again.
I can't get a breath. I can't get a breath. Oh god. Oh god. Oh god. I have this pain in my chest.
Yeah, cocaine doesn't look fun at all. Vice City lied to me.
Right in the middle.
It's just a bad trip walking off.
This pain. Ow! It moves down it starts on the side of my face, right? And then moves down the side of my arm.
I hate when I've got face pain.
All the smoke in the club.
Your face hurt.
I had a couple of
Sure
martinis
killing
earlier,
me.
okay? Ah!
You know, without context, this will seem really,
Okay,
really
look.
awkward to listen to.
I've had a little problem with cocaine. I went away to rest. Like
So
a
everything,
workout.
I guess, is in
It's
order.
my problem. And
All of the
I mean,
cases.
I swear, I don't do it anymore, okay? Oh, I don't do it anymore. But do you think like in some way this could be like a residual effect from my past habits? Oh!
Yet 2 years ago, your cocaine habit is back to kick you in the butt.
I gotta get home.
Yo, Doc! Little attention here!
Your voice totally changed. Oh god. Oh god. Oh. Good. Good. I'm gonna use the stethoscope so I don't get yelled at. That sounds like...
Look, don't call my husband, please. He'll be mad. I mean, he'll be worried about me, you know?
Good save. Good save. Insert more cocaine. She's going through a withdrawal, so just give her more. There you go. Oh, wasn't her nose all bleedy?
I take back everything I ever said about county hospitals.
I got your nose.
Springsteen, third row, backstage pass.
Dude, I know, right?
My friend.
I do so much coke at my Springsteen concerts. Pen light. Yeah, why not? Beep. I don't know what that accomplished.
Doc, you rock.
Yeah, I put a light in your
Into
face.
my jaw and down my arm.
Totally fixed her. Tea in this, please.
Listen, I said I was clean. This test a waste of time.
Yeah, right.
I know this friend who has this friend who has lunch with an agent who could get you on ER, the TV show. Interested?
Does it come with cocaine? Blood test. You got it.
Blood test? Why? What are you looking for?
Your thumb's got high amounts of cocaine, lady.
Addictions? they're a constant battle, you know?
I'm addicted to saving lives. I don't know, maybe I shouldn't poke people in the head. Always draw from the pinky. Probably.
Yeah, I did a lot of powder. Large powder. But that was years ago. I kicked.
Use an ultrasound. Maybe she's pregnant with cocaine? I don't know what that's gonna tell me.
You fix me up, I fix you up. Right, Doc?
Are you offering me drugs? Large powder, you know it. Inject their eyes, you can only inject the
What's
left
with
arm.
the 20 questions? I'm clean. I swear.
She seems to be okay now. She's freaking out way earlier. Oh, oxygen. That's not a bad idea. If I can only find it. There you go. Yay! Look how happy she is. Her heart's broken. Well, mine too. X-ray? Why not? Bloop. Indicates recent drug use. Can I just call the police? Oh, I forgot the IV. Gotta be reminded to do the IV every time. Bloop. Can I call the cops? Oh, something's happening. She's in a really bad way at the moment. You can't do a CT scan on the chest. Well, actually, no, I lied. You can. What haven't I done? Oral meds. Where's the aspirin? Where the heart explodes. There. Oh god, 198. Here's topical meds for your chest? I don't know. Here's some butter. Oh, nitroglycerin, that's what that was. It's a different thing each time. This is over 207. I'd be lying to you if I told you I knew what I had to do now. I'm not defibbing her. You know, I'm gonna say she's fine. Am I sure that number isn't my score? That's a very good point. It might be. If my score is 207, I'll take it. I don't think her heart rate's 200. Fairly sure it isn't. Manager of rock bands. Let's see. Intensive care sounds like a thing she probably needs. Hopefully she doesn't die by the time I'm done filling this out. The alert thing seems kind of sketchy to me. Standard holding, I have no idea. Transport, monitored with a doctor? She might be dying, but I don't know what to say. Diagnosis, where's the drugs? Diagnosis, doop-a-doop-boo. Motor vehicle. Motor vehicle. Wrist injury, gunshot, left arm, toothache, unknown toxic. It's none of these. Not a polydrug overdose. It's a one-drug overdose. Cocaine. God, where is it? I know. Oh, am I with drugs? It's right there. How did I miss that? Let's see. Discharge. Is there an emergency thing? I can't save the patient if I can't check the box. Go back to the beginning for rehab. Is rehab on here? I don't think I've ever seen it. I mean, here? Oh, you're right. Rehab/drugs. I need to slow her heart. Nah, she'll be fine. Get the police. Okay. I'll be a terrible person. Where's the police? I know police is an option. You're gonna wish you never got better. No police, she will kill me. Eh. I didn't do it last time. Pee on her heart. I don't think that's going to help. Cardiology? No. Well, I guess cardiology doesn't seem like a bad idea. Special services, police. Drug and alcohol. Is contacting the police illegal? I don't know. Aftercare, I'm not sending her home, though. It's illegal to get the police. Is it? I want to see if they actually have a video clip for the police coming in. I'd be curious to know. Did I do everything? I don't know what else to check. Holding orders. Intensive care general? I don't know. I guess I'll call it a day. Why did I make this my name? I'm never gonna know what any of these scores are. Ever. She's still dying. Well, you know what? Shouldn't have snorted all that coke. Any minute now. I can't rename my guy. It just has to go through this every time. Every time. Am I not allowed to call the police if somebody comes into the hospital on drugs? It doesn't seem like such a bad thing, you know? She couldn't help it, there wasn't any Pepsi. I really want to see if the cops show up. What's my score? It looks like actually 220 something out of 300, but I might have made that up.
I almost bought the big one this time, huh?
You're going to jail.
Must be God's way of telling me it's time to grow up.
Oh.
Look, I put in a call to Casa de Betty Ford. See if they'll have me back once I get out of this place.
Oh, after this place, you're going to the big house.
Look, I'm sorry I lied to you, Doc. It's another one of my bad habits.
Wasn't a very good
I'm gonna
lie.
make it up to you. Tickets to a really good show this
Tickets to
weekend.
coke.
And backstage passes, too. Okay?
Tell me where I can get what I really want.
Right. You are... don't remember the name. Another
Dr.
first
Tim,
name, right?
Esquire,
Welcome.
Dr. Oh.
I don't know what you've heard about the residency program here at Legacy, but whatever it was, forget it. As far as I'm concerned, we're starting this year with a fresh slate. That means we expect much more from our residents than we have in the past. My aim is to make this one of the toughest, strictest, and most respected programs in this
She
country.
better be happy this time.
Without some damn good doctors in the process. We're becoming very hands-on with our new residents. I personally will be reviewing all of your work. And I can promise you, I don't miss a thing.
She winked at me.
Really, Doctor? I expected more from you.
Wait, did you? What? But I do.
I know we don't want to aggravate a patient's condition, but confirming and locating pain are vital to a proper diagnosis.
It's a bleeding
to
wound.
properly address and treat the patient's pain, I see you opted for the med
I didn't need to
syringe.
touch it.
Good choice. Before you treat the wound, it's important to cleanse the area. Well done. It's nice to see you didn't forget the basics. You needed to bandage the wound, and you did.
I
You
did
correctly applied topical medication. The
Topical
treatments
med.
indicated were not necessary.
said they were.
The treatments indicated were not
What?
necessary. You forgot to suture the wound,
No,
doctor.
I didn't.
You discharged this patient with an excellent plan for
I'm sorry,
treatment
what?
and follow-up.
Okay. Suturing the wound was not necessary, but you forgot to do it regardless.
Your hospital orders list is incomplete.
Oh.
Well done. You correctly diagnosed this patient's problem.
Oh. Yeah, it was a dog bite.
While this patient's case was not critical, I expect a higher standard of care from you.
Incorrect procedures. Suture and needle left hand? But wait, I didn't suture the left hand. I had to do the arm, but I did the hand? But that's not where the... Alright.
The
Whatever.
lead poisoning case.
Whatever.
Put yourself in the boy's situation, Doctor. Do you really think you'd be here if you'd grown up facing this kind of poverty? Doctor, did this patient present signs of heart trouble?
He could have.
Then why the 12-lead EKG?
No,
What was your
push the
justification
button.
to listening to this patient's chest with a set of presenting symptoms like this? I know
was
we
damn
don't
useful.
want to aggravate a patient's condition, but confirming and locating pain are vital to a proper diagnosis. I think you'll agree with me that the CBC was invaluable for identifying this patient's problem. Pushing for this test was the right thing to do.
Thanks.
Without the information the screening provided, it would have been even more difficult to finger paint chips as the culprit. Sharp eyes, Doctor. This patient's weak state demanded the introduction of
I
intravenous
can't tell if I'm
fluids.
ever doing
You forgot
well.
a few items, but on the whole, your discharge orders were good.
You kind of sucked at everything, but, you know.
You signed the patient into the hospital, but failed to list a comprehensive plan for hospital care. Be more careful next time.
I'm sorry.
You found the cause of this boy's symptoms. Good work. You did what you had to do to save the patient, but just barely.
Barely. If I... He might have died because I didn't do the stethoscope on his chest. Man, am I sloppy today or what?
Jackie Slavin. Difficulty breathing, history of drug use, and in the music industry. Big surprise. I'm glad to see you checked rhythm. In a case like this, it's crucial.
Yeah, she's
I
in the
found
concerts,
this
I'm all about
patient's
rhythm.
BP particularly telling. You did too. Good work. I can't believe the RR on this patient.
Damn it, Monotone.
What you should
You're a
learn from
renegade
this
doctor,
is how
but
effective
you
the
get
12 lead
results.
can be in determining heart ailments. Excellent. The blood test returned evidence of elevated cardiac enzymes, telltale signs of an MI. Signs of wheezing, labored breathing, or rapid breaths need attention. You helped the patient by administering oxygen via
guess. I
mask.
just wanted to
The
touch
right
her face.
decision. Sharp eyes, Doctor. This patient's weak state demanded the introduction of intravenous fluids. Nitroglycerin pills are a staple to treating victims of heart attacks.
I just ate the whole
I'm glad
bottle.
to see you offered this necessary treatment. You correctly applied topical medication. There were a number of important items missing from your discharge orders, Doctor.
Wait. Cardiology was incorrect? Drugs and alcohol and police? I thought those were okay. You know? Maybe not police, but cardiology? Okay.
There are too many items missing from this sheet of hospital orders, Doctor.
Emergency urgent consultation cardiology. Isn't that what I put?
I'm glad you saw past Ms. Slavin's feints and made the right diagnosis.
Wait.
Cocaine isn't exactly truth serum.
So, you just admitted she was on cocaine, but a cocaine overdose is the incorrect diagnosis? Is that what I'm hearing?
You did what you had to do to save the patient, but just barely.
Sure. Cocaine overdose was incorrect. But correct. I guess.
Let me guess.
Hey, look, I pissed
Just
off
finished
one
your first
person
shift,
today.
right?
It's better than
I can always
nothing.
tell. You got that look. Like a raccoon caught in the headlights. Seen
That's
it
my lead
100
poisoning.
times. Don't worry, your shifts are only going to get harder.
Oh, she didn't overdose on cocaine. She just had a regular dose.
Why don't you relax in the break room? Take a nap,
These
have a
pork
snack.
rinds are damn useful.
You'll be sorry if you don't. Next shift will begin before you know it.
God. This game, I don't think it's very useful, damn useful or otherwise, into actually practicing medicine. To the to the doctor's lounge. I don't think this is a dating sim, no. Can I date the coffee?
Be very careful of the Java around here. So I was just going over the charts
Why?
for your first shift.
Is it spiked?
Particularly John Chu, that lead poisoning case. Excellent work.
Thanks.
Some of our more over-enthusiastic doctors might have been aggressive with Lian Chu, maybe calling in social services about the safety of the boy, but...
Not me. I never do
saw
that.
there were no previous reports of neglect and that the mom meant well by her son. What I am going to do is send a public health worker over to visit them. They'll help the mom clean up the place. And make it
The
safe
coffee
for the kids
contains
to live.
lead. The Java is
Get some
cocaine.
sleep before your next shift. You'll need it. Oh, and make a fresh pot of coffee, would you?
Hey man, I'm a doctor, not a gopher. Make your own damn coffee.
It was nice and quiet around here till about 5 minutes ago. Hope you bought an extra pair of scrubs.
Smug jerk.
Work around children, I seem to get
Okay.
these darn flu bugs.
It's not bronchitis.
Teachers
It's
never miss a day.
pneumonia.
Seem to have better resistance. And I've used up all my sick pay. I can't afford this. Not now. Please, not now.
Is she wearing a blanket? Oh, it's a sweater. Don't let this happen to you.
Truthfully, I don't ever remember feeling this bad.
Is this how real hospitals work? Just keep getting the
Sometimes
same
I
patient
wake up
over and
in
over
a
until you
cold
cure them?
sweat.
Yep. Pretty much.
I'm nervous,
Nope.
so it's understandable if my heart's beating a little fast.
Beep, 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 beep.
It's a miracle what they can do with technology these days.
Someone needs oxygen. I love how this person can be going to school teaching kids
My daycare
with this
children.
disease, but they can also just die in 5 minutes the instant they come into the hospital. That seems a little bit sketchy to me. Here's an IV. Boop. IV meds? Why not? Boo boo doo boo boo. Let's poke the needles. Boo! There. Being all efficient with my space. I don't think you can treat diabetes in this. So I'm assuming that's my score, which is 74. I think. Stethoscope. Cure her old. Fluid in the lungs. Oh, God. Is that what wearing a bra does to you? Doesn't seem like it should be that hard. What was I gonna do? Oh, X-ray. Because fluid. Bloop. Do 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 do. Well, I have a score of 132. I'm just gonna leave her like that and call it a day. Use the glove. On what? What is this accomplishing? Skin is moist and warm. Well, how would I know if it's moist? I got a glove on. Oh, someone's posting the Amazon link with an affiliate thing. I have an Amazon affiliate thing and I barely ever use it. Let's see. Oh, blood gas. I forgot to do that last time. Got chewed out. I'm helping. Elevated white blood cell count. Okay, bacterial infection. Swab culture. Okay. Do I need oral meds? I think I do. Can you upload the music track? I'll take a look. I'll see if it's like an MP3 or something that I can take out. Remind me either once the stream's over